learning and knowledge on best practices. We embrace a transdisciplinary approach grounded in the belief that complex issues like climate change that are non-linear, multifaceted, and far-reaching require collective and cross-sectoral strategies. It is through collaborative efforts, of course, that integrate in diverse disciplines and engage communities that we can design effective context-specific solutions for the populations most impacted by these challenges. A couple of years ago, Arin identified the need to create a space where global experts could come together to tackle issues of shared human concern. This vision led to the inception of the Arin Conference, which has since established itself as a forward-looking platform addressing contemporary challenges with each annual theme. So therefore, our theme this year, Bridging Knowledge Gaps, Promoting Transdisciplinarity for Climate and Health Resilience, places a critical focus on the intersection of climate change, health, and transdisciplinary collaboration. Today's side events will explore two critical initiatives that exemplify this commitment. The Consultative Platform for Climate and Health in Africa, CAPTCHA, is an Arin-led initiative that unites climate and health stakeholders across Africa. CAPTCHA's goal is to build health resilience in the face of climate change and integrate real-time data with community needs, resulting in health strategies tailored to regional climate profiles. With strategic cross-border cooperation, CAPTCHA aims to ensure that Africa is well prepared to protect the health of its populations in a rapidly changing climate. The second side event this morning is community-led ecosystem-based adaptation planning, and this will be presented by Slum Dwellers International and Muungano wa Wanavijiji. And this is an initiative that addresses climate-related health risk in urban informal settlements. It focuses on community-driven approaches, local knowledge, and partnerships. This initiative, of course, showcases how community-led actions can cultivate climate resilience in Africa's most vulnerable urban societies. So as you can see, these initiatives are Arin's dedication to promoting transdisciplinary collaboration and achieving real-world impact. We therefore look forward to a deeply engaging and interactive conference that will drive significant progress towards our shared goals. Once again, welcome to all of you, and without further ado, it is my pleasure to invite Arin's Executive Director, Dr. Johannes Atela, to deliver the opening remarks. Dr. Atela, kindly welcome. Welcome, Dr. Atela.
Thank you, Florence. You are a little bit far from the camera, so I hope that you can adjust that so that our participants can have a clear view of who is moderating the session. So maybe the IT team could work on that. So our distinguished participants in this very timely event, the Arin 4th International Conference, focusing on climate change and health. We are glad to have you to be part of this timely conversation. As our moderator of the session chair has mentioned, the Arin network is a network of researchers and policymakers across 36 African countries with the mandate of consolidating evidence on what works or what does not work, and trying to bring Africa to have a collective leadership with regards to the knowledge system and evidence that tackles some of the pressing challenges that the continent is facing. The Arin network profiles or sort of provides leadership in the continent through founding critical empirical evidence in different African contexts. We know that Africa is a land that has been characterized by several research initiatives, and there are quite a range of evidence or research or scientific information that exists in different contexts. But in one way or the other, we have not been able, or there is a big gap in terms of trying to consolidate this empirical evidence so that there is a much more stronger knowledge leadership from Africa in ways that then can influence policies at different levels and also can create a much more focus in terms of the Africa's engagement with the international processes. So Arin fills this gap by ensuring that thought leadership and positioning at the international spaces is based on empirically grounded evidence on what is happening and what are the needs, or what the needs are of our of Africa's people. And in so doing, we foster South-South collaboration and knowledge leadership in ways that are actually placing Africa in a competitive space within the research and development space. As our moderator has highlighted, Arin also provides a very strong platform for peer learning, bringing different experiences, different research activities that are taking place in different contexts, trying to create visibility of these particular good research practices. As you know, Africa's research agenda is progressing well, and there is already remarkable improvement in terms of the amount of knowledge products that come from Africa. But at the same time, we have really an increase in the numbers of people, early career researchers, who are really venturing into impactful research. Arin, through its convening power in the continent, provides a platform where these researchers can be visible, their ideas can be visible, and their ideas can be connected to form a much more transdisciplinary outlook for the continent's research and development. And therefore, we are proud that we hold this conference every year. And this year, our focus is on the aspect of climate change and health, and trying to see opportunities for enabling connections between the climate change field and health fields, which have traditionally been operating or working in isolation. Our distinguished participants, as you are aware, that the biggest impacts of climate change today is the impact that this has on health. And this is because without good health, we can't work. Without good health, we can't achieve our aspirations as underpinned by the Sustainable Development Goals, but also as underpinned by our blueprint, the Africa's Agenda 2063. Good health and well-being is very critical for the achievement of any aspirations that we have. Therefore, the impacts of climate change on health is a critical concern for most African stakeholders, especially researchers and policymakers. So, distinguished participants, you are aware that the world has taken a transformative step towards addressing the impacts of climate change on health. And part of that step is anchored on the element of integrated solutions in ways that tries to really bring the health and climate change issues and sectors together, to work together, and to be able to develop evidence and be able to develop solutions. The establishment of the attached framework during COP26, which for the first time brought together a number of health ministers or health decision makers and researchers to be part of the climate change discussion, marked a very important point in terms of pursuing transdisciplinarity, in terms of pursuing integrated solutions. As you are aware that for a long time, these two fields of climate change and health have been operating in silos. The health researchers are doing excellent health research, whether in terms of impacts of heat on mental health, impacts of of floods on vector-borne diseases, and many other research topics that are being pursued. On the other hand, decisions on climate change have been dominated by the climate change scientists, including meteorologists, of course, social scientists in that space, resilience scientists, among others. And therefore, these two fields are well developed. But with the change and the transformative focus on integrated solution, as inspired by the attached framework that was pushed by the WHO, the World Health Organization, the need to bring these two fields together is very critical so that there are actually options or opportunities for developing integrated solutions that could work across sectors and minimize challenges that we face when this issue or this challenge is addressed in isolation. And therefore, today we are starting our conference with this side event, which is going to present to us the platform called the Consultative Platform on Climate Change and Health in Africa. So this is a platform that is emerging from a number of studies that we have pursued or engaged in as Arin, and of course as with other partners. And in these studies, the biggest gap has been the need or the lack of opportunities or spaces where we can bring the climate and health communities together to have conversations and to nurture transdisciplinarity. And therefore, this particular platform begins to spur or to catalyze that conversation in a much more continuous and sustainable way. And I do hope that the presentation about the platform is going to really inspire us to begin thinking about how best we can work together, how best we can bring our ideas together, how best we can have conversations that enables us to create integrated solutions with regards to climate change and health, because that is what is needed. The political will for integration is there, as I've said. What we need now are the evidence to be able to support or strengthen that particular political will. And therefore, this forms the basis for this particular side event, but also our entire conference, that this conversation is going to push us into a journey of connecting, a journey of linking up, so that we are able to really collectively and in a truly collaborative way, generate research questions, generate research agendas, and work on these particular agendas collectively, and then use the resulting evidence to produce integrated recommendations or solutions that can be taken up to support our national, regional, and international policies on climate change and health. With those very few remarks, our chair for the session, I want to again take this opportunity on behalf of Arin, welcome all the participants to this side event and to the main conference that will be kicking off this afternoon. Thank you very much, and looking forward to a very exciting engagement.
Thank you very much, Dr. Teller, for that insightful keynote address. It actually sets a clear foundation for today's discussions. Your words have highlighted the urgent need to bring the two fields, that is climate change and health, together. You've also brought the issue of transdisciplinarity, which is very key as far as realizing the sustainable development goals is concerned. The next item in the agenda is a panel discussion, and we have panelists who are ready to present to us on the consultative platform that is Capture. And we have Dr. Humphrey Agevi, who is a leading voice with a deep commitment to advancing climate resilience. We also have Anne Irungu, whose expertise lies in integrating health perspectives into climate adaptation strategies. We also have Ezekiel Gordon, who is a GI specialist. He'll be presenting sometime later on climate change and mapping. And may I take this opportunity now to welcome you, our esteemed panelists. Thank you.
Hello, everyone. My name is Anne Irongo, the Capture Coordinator, and I'm going just to reintroduce the platform and the progress that we have made so far and the impacts that we intend to make in the climate and health space. Capture was launched 3 months ago and so far has garnered interest in the climate and health space in Africa. And this event seeks not only or seeks more than just creating awareness of it, but also it seeks to seek perspectives and partnerships on making it better with wider impact. So next slide, please. Next slide. So just a little bit about the background is that climate change presents severe threats to public health, especially in Africa, where there are heightened risks due to extreme weather events, strained healthcare systems, and fragile socioeconomic conditions, and the lack of robust early warning systems and context-specific data impedes effective climate adaptation, as most data is derived from the global north and may not be relevant to the African continent. Also, the climate policies often overlook the intersection of climate and health, therefore hindering comprehensive regional adaptation strategies. In terms of the funding and capacity challenges, funding for climate and health initiatives, especially in Africa, is insufficient, with many relying on short-term donor-driven funding, and there's therefore a notable absence of climate change and health courses or fellowships in Africa. So some of the insights from our consultations, we saw that there's an uneven stakeholder engagement. As much as it is increasing, it remains uneven across Africa, and regional research networks are vital in bridging the gap between the global guidelines and the national actions. In terms of policy opportunities, there is a crucial need to shift towards integrated solutions that address broader social determinants of health. There is also a lack of robust mechanisms for translating research findings into actionable policy recommendations, and localized data collection tools and specialized knowledge translation units could help fill these gaps. On emerging policy opportunities, as it has been discussed, there are initiatives that are becoming for example, the Alliance for Transformative Action for Climate and Health, which is driving renewed global and regional ambitions for integrated climate and health policies. In terms of funding, there is an underinvestment in health adaptation, with only a mere 0.5% of climate adaptation funding allocated to the health sector. Therefore, this underscores an urgent need to boost investment in climate-related health initiatives. There's also a need to strengthen capacity building, especially in critical areas such as leadership and investment skills. So comprehensive training programs are essential to empower stakeholders to seize opportunities in climate and health financing. for the rationale, why did we come up with the consultative platform for Africa climate and health? So there's a need to nurture transdisciplinarity and multi-sectoral approaches, which is not a one-off thing, but it requires a dedicated long-term sustained sharing and learning between climate and health determining sectors. There has been existing efforts, that is platforms and networks that have been able to create engagements between climate change and health communities. However, these efforts have not been focused on facilitating the much needed transdisciplinary communities of practice on climate and health. And instead, the focus has been on general convenience, data visibility, and advocacy. So Capture is a dynamic platform that will help facilitate continuous connections between climate and health determining disciplines and policies, so as to build a transdisciplinary community of practice towards enhancing integrated, inclusive, and resilient health systems in Africa. So this is just a picture of the interface of our Capture website. More will be shown on its interactiveness by the next panel speaker, and we'll show on how much progress we've made in terms of data collected and much on climate and health generally. So these are some of the platforms that are in existence, and I'll just give an overview of just two that are prominent. We have the Chance Network, which is a network that fosters collaboration among climate and health experts across Africa to address the intersection of climate change and health. We have the Klima Health, which is a joint initiative between WHO and WMO that serves as a global resource for information and guidance on the health impacts of climate and environmental change. We also have globally, we have the Lancet Countdown on Health and Climate Change, which is an international multidisciplinary collaboration tracking the impact of climate change on public health and progress on health-related climate policies. So the goal for Capture is to establish a coordinated approach to understanding and mitigating health challenges posed by climate change through centralizing data and promoting joint research, advocating for policies and addressing climate-related health impacts, strengthening the ability to respond to climate health impacts through capacity enhancement, as well as fostering partnerships across sectors through multi-sectoral collaboration. We have three components. We have the database dashboard, where we will have a repository which will help in centralizing data and analytics for stakeholders in regards to climate and health. We have a knowledge sharing and engagement facilitation platform that will help enhance transdisciplinary connections and collaborations and hold climate and health dialogues as well as conferences. And then we have a component on knowledge translation and policy, where it will help bridge between science and policy, ensuring evidence-based decision-making through synthesis reports, position papers, as well as mini grants. So today I'll just give a brief overview on the data gaps in climate and health. And when I talk about data gaps, I refer to missing or incomplete information needed to understand how climate variables such as temperature, precipitation, and extreme weather events affect health outcomes such as disease incidence, mortality, and health infrastructure. So these gaps hinder effective decision-making and policy development, and without this comprehensive and accurate data, necessary strategies to mitigate the adverse effects of climate change on public health cannot be implemented. So on the types of data gaps, we have granularity, which is the low level of details, and it refers to the level of specificity in climate health data collected. For example, national malaria data may fail to reflect the local variations where microclimates influence transmission rates. And this lack of detailed data at local levels may obscure the understanding of how climate change impacts health and tailored interventions in specific regions or communities. We have temporal coverage, that is the long-term data gaps, which refer to the duration and frequency of climate health data collection over time. So short-term climate and health data make it difficult to attribute health incidences to climate change and track long-term trends or climate health shifts. For example, if there is an incomplete data on seasonal health risks like malaria, it may limit understanding of changing disease patterns over time. Therefore, long-term climate and health data is essential for predicting and preparing for future health crises linked to climate change. We also have cross-sectoral data, that is integration of data across all sectors. When there's siloed data, this limits the ability to view climate and health impacts holistically. For example, air quality impacts respiratory diseases, which is in the health sector, and influenced by agricultural practices and urbanization. These in terms of like agricultural practices, the burning of crop residues after harvest, it releases particulate matter, which can exacerbate people with chronic respiratory diseases, for example, asthma or bronchitis. In terms of urbanization, transport, we know that there are harmful emissions by vehicles as well as construction industries are the largest emitters of global health gases, with accounting for around 37% of global emissions. So there's a need of integrating cross-sectoral data, which will provide a more comprehensive understanding of climate health dynamics as well as inform policy development. One of the key challenges in data collection is the resource constraints, where many African countries face limited budgets and infrastructure for collecting comprehensive climate and health data. For instance, there might be a shortage of trained personnel or insufficient technology to monitor air quality and its correlation with respiratory diseases. We also have inconsistent data collection methods where climate-related diseases data like heat stress may be collected using different methods in different regions. For example, some regions may use weather station data, others rely on satellite data. And this inconsistency makes it difficult to compare findings across regions. There is also lack of data sharing infrastructure, where the health data often remains siloed in government departments or research institutions, while climate data is managed by meteorological agencies. Therefore, this lack of integration makes it difficult to link climate events to health impacts. So in terms of another challenge is the standardization of data collection protocols, where, so CAPTCHA's platform has a strategy for bridging these data gaps, where it will come up with my apologies for that. So yes, so CAPTCHA has a strategy for bridging the data gaps, where it will come up with the centralized data repository, where it's co-creating a centralized online platform where data on climate variables such as temperature, rainfall, and health outcomes such as disease incidents are stored in a user-friendly format. This data will also be triangulated to come up with findings that can bridge the attribution gap and help inform effective interventions that are tailored to specific community climate profiles. It will also allow stakeholders from across Africa to access relevant data, contributing to a deeper understanding of the relationship between climate and health at a national and a regional level. And also it will reduce the duplication of data collection efforts as well as enhance cross-country comparisons. It will also try to come up with a standardized data collection protocol across different climate and health research initiatives by including guidelines on the types of climate data to collect, how to monitor health outcomes, and how to report this data. Because having consistent data formats and collection methods will enhance the ability to compare and analyze data across different regions and timeframes, which is crucial for policy development and intervention planning. So it is also co-facilitating and building partnerships between climate scientists, health experts, and policymakers. For example, not only is it trying to bring partners on board, but through its vast network of mapped climate and health initiatives, it can connect a team studying the effects of drought on food security with health researchers looking at malnutrition and its relation to climate change. So these partnerships will encourage the pooling of data from multiple sources, resulting in more robust data sets and a more comprehensive understanding of the climate health nexus. It will, the impact of CAPTCHA's efforts on research policy, it will help improve early warning systems for climate and health risks by integrating climate data with health data and therefore help in predicting health crises. For example, it could forecast malaria outbreaks by analyzing climate conditions in specific regions. And this predictive capability will enable policymakers to implement preventive measures such as distributed insecticides treated bed nets before the peak seasons. It will also help in evidence-based policy development, which will allow policymakers to access region-specific longitudinal data that will reveal the impact of climate on diseases like heat stress and malaria, therefore enabling the creation of evidence-based policies for climate change, such as setting up early warning systems for health threats. We have a call for collaboration where we are open to partnerships with researchers, organizations, governments, and funders. We are also trying to integrate data sharing where researchers can contribute their own data sets to capture centralized platform to help fill the data gaps. And this will help strengthen the impact of CAPTCHA and contribute resources as well as expertise. So you can follow us through those links to our various social media platforms so that we can engage further. Thank you.
Thank you very much, Anne, for that elaborate presentation on CAPTCHA. You have spoken about opportunities for capacity building, policy opportunities, translational research, and you have also spoken about transdisciplinarity, which is our unique position at Arin. I personally think that the CAPTCHA initiative, if well managed, promises to be a game changer in Africa's approach to climate and health. It will be very critical in addressing crucial gaps by providing innovative solutions. However, it will be interesting to know how, with a fraction of African countries currently having climate policies that address health, how CAPTCHA plans to work with policymakers just to ensure that impacts are incorporated into national climate frameworks, and how it will advocate for region-specific health priorities, especially at the global level. But as we ruminate over these thoughts, let me take this opportunity to welcome Dr. Agevi, who will present on how CAPTCHA aligns and influences policy across the continent. Welcome, Dr. Agevi.
Yeah, thank you very much. Good morning, good afternoon, all participants, wherever you are. We welcome you once more to this particular gathering that is aimed at sharing insights and also actionable findings from the research we are doing globally. And it is quite insightful that we have people from all over the world who have come here together just to listen to what researchers are able to do. as my colleague has said, that Capture is a platform that is very unique as compared to other platforms that already are established. The reason being that Capture is a platform that we are using a co-creation idea in trying to come up with it. It is a platform also that is going to leverage on transdisciplinarity, where we are going to get data from different aspects of research and see how we can be able to integrate, so that then once we integrate within the Capture platform, that the platform is going to be a one-stop shop where any stakeholder will be able to get or access this data and use it depending on the needs that this particular stakeholder wants this data for. So it is quite interesting that Arin is leading in that area. And when you look at it keenly, you will find that also this conference and also the discussion around Capture has come at a very crucial stage, where next week the world is convening for the COP29 conference. And that is where we are going to share insights with regards to climate change and health, among other issues. And number two, also, it is also a convening where the world is going to look at if they can be able to come up with the new quantification goal when it comes to climate change adaptation. And for all this to happen, the goal or the discussion, there is need for data. And that is why Capture plays a very crucial role. Number two, when you look at the platforms that already exist, they could be capturing data, but then this data is somehow global. Not all the data at the localized, the community level is captured. And that is where the climate change impacts are usually felt. So the uniqueness of Capture is we are going to collect what we call the localized data that will even help in further research, that will even help in decision making, and also that will also contribute to effective policy making in Africa, so that the policies can help address matters of climate change and health. Just to mention about data, there is then a relationship between the data, for example, we are going to capture, and the health national adaptation plans that African countries are trying to put in place. As the executive director said, and also as the previous speaker has said, that the aspect of integrating health within the climate change space actually was muted in 2021 during the COP26 conference. And this conference, that is where the idea to enhance climate resilience and sustainable low carbon health systems was muted. And in 2022, that is when ATACH actually was launched. And this was just to enhance the different abilities of African countries to integrate health perspectives within the climate change. And up to now, a number of countries within Africa have tried to establish or put in place frameworks that can enable them to have what we call health national adaptation plans. And when you look at it, in August 2024, Uganda was the first African country actually to launch the Health National Adaptation Plan. And I'm happy that even today at around 3 p.m., one of the presenters is the one that actually initiated that idea in Uganda and was awarded by the Ugandan government for his efforts to ensure that that plan is put in place. For these plans to be put in place, there is need for data. Data, and this will come, for example, through doing what we call the climate change health vulnerability assessment, or also coming up with the climate change health national adaptation plans. All these need data. And that is why the Capture platform is going to be a one-stop shop that will help even some of these countries with the needed data that they can use as they continue to put in place the health national adaptation plans. For example, like we speak now, for these health national adaptation plans to be put in place, there is need for these countries to undertake what we call vulnerability assessment. And currently, up to now, it is only 8 countries, that is around 30% of the African countries that have already undertaken what we call the health vulnerability assessment. And also around 6 countries have begun the process of putting in place the health national adaptation plans. So it is very crucial because the data that we are trying to integrate here will also be very crucial for these particular countries. One of the things also that is hindering the African countries also to come up with these particular plans is the issue of capacity. And this is something that also we are going to ensure that we also contribute to the element of capacity building to ensure that we also help different regions to put in place such plans. The plans are crucial because they will help in strengthening what we call the health and climate resilience of different countries. They will also help these particular countries in doing what we call disease surveillance, among other things. And it is crucial that we are coming into this space to offer a platform that will help the countries to develop these particular plans. So as we move forward, I invite now my colleague just to take us through some of the data already that we have and how we have been able to maybe integrate or change it into the data that is needed by the different stakeholders. Welcome, Gogo.
Hello, good morning, everyone. Good afternoon, wherever you are. I'm taking a little bit of small minutes to explain what we have on the Capture website so that it helps us navigate and we can able to go through and have a feel on what we have and see the collaboration that we're talking about and what we are trying to achieve on talking about Capture. I'm going straight to the components that we have so that, of course, there are some other aspects as well on the home and about Capture, and some of the blogs and also some information on the Arin conference that we're hosting from today up to Friday. So if you look at the components page where we have the 3 of them as highlighted in the screen. The first one is on the stakeholder database that is on the section that connects the climate aspect and the health aspect. Also, my colleague talked about the health national adaptation plans and the implementation status in Africa. And the third aspect is on the knowledge translation. This is where we have the interpretation of does the climate data exist alone, or can we incorporate all the climate aspects such as temperature, rainfall, with the disease variances such as the virus in a particular area, and also does the land use in that particular section play a part in that regard? Also, with respect to whether it's a local level, subnational level, or national level. So I'll just take a deep dive from the stakeholders database and see what we have so that this can help us in interacting with the dashboard. So as you open the database, it gives us various tabs where we can visualize the data that we have already on the data on the dashboard. So the first tab just highlights the stakeholders database based on the region where they are located, and this is highlighted on the side of the dashboard with the areas highlighted as from Central Africa to West Africa. As you go towards various tabs, and the next tab is talking about the pandas per country, and also you can see that this, of course, this data is derived from the project that we did on the transdisciplinarity on the climate, health, and change. Another aspect that I'm going to talk about is the data set that is being provided on the capture is also interactive. If you put the cursor on each and every one on the data spots, you can able to see what that is being displayed, what's being captured there. For example, that one is West Africa region. The stakeholder there, the name is being displayed as association, the name, and the city is there, and the country is Burkina Faso. The main funder is there, and the main sector that the funder is involving. So as you go towards the next one, this also talks about the total number of stakeholders, and you can see this is per country. We have various sections as well. As you move around, this will also give you a feel of, for example, Algeria, how many stakeholders we have that we already mapped in capture, how many stakeholders are existing in that country. As per now, you can see Kenya has the highest number, which is 35. This could be bad because we are based in Kenya, but the process of data mining is still continuing. So you get more information from all the data sets. Again, the next tab gives us the number of sectors per region, per country, per city. So this is even more robust. You can able to see, and from a region perspective, narrow down to how many countries in that region, narrow down to the city, and what are the main sectors that are involved with. Again, when you reach at the sector, you're able to the information on the sectors, so that you get the full picture of what the data is talking about. This cuts across from Central, East Africa, North Africa, and Southern up to the West Africa region. Again, the next tab, which for as far as the database is concerned, this is the last one. Let's talk about the geographies. This is in terms of the number of database, the number of stakeholders as per what are their scope, either national, local, or they are dealing with regional, or they have a global scope, and where they are located. So, for example, in Botswana, you can see that you have two stakeholders. One is a national scope, another one has a local scope, and this varies as you go through this database of ours. And of course, like I said when I started, this is a continuous data that will keep on improving, keep on changing because of the new aspect, the new stakeholders are coming on board on this field, so that we have new information as time goes by. If I go back on the health national adaptation plans, like my colleague was saying, here again, this shows the implementation status of each country in Africa. So far, this scope is Africa, and again, the legend explains whether it's implemented, not yet, or under consideration, and the interactiveness is also still achieved by hovering over the countries, so that you can able to see more information on the integration, or whether it is the status as per the legend highlighted. The last aspect of this capture component that talks about knowledge translation is this is where we are going to introduce data stories, how to incorporate climate change health data together to have that. I'm going to share a Word document to show how this is coming into place. But in the meantime, you have a feel of what the website is about, and this data stories I'm talking about is going to be incorporated in that in that knowledge translation section. When we are talking about capture, when my colleague Arin was presenting, there was some aspect of how to collect temperature. So this is just a profile of Nairobi to highlight what has been the surface temperature for Nairobi, and this shows how the temperature is distributed. So with this incorporated with the health data can help assist and even progress in terms of the study. When you select a study site, you have data information about an area before you progress on the project that you're doing. And this also promotes the intersectionality of the temperature and other data as well. So the other aspect of data that I was going to display is the land use, land cover data sets. And this is the human interference when we talk about the land use. Land cover is what is it's covered on the surface. So this helps in generate land use, land cover maps over a period of time, and this explains and this will form basis of the story map I was talking about, because it assists in generating this. Of course, with this kind of work, it's still ongoing and need to be incorporated, and some of the limitations so we're talking about is data sources. Where are we getting this data? How good is the data? How can we collaborate? How do we record? How do we share? So these are some of the materials that will come into that knowledge translation. Of course, after we incorporate, we share, and that's how we try to populate the dashboard and the capture website so that it becomes informative for our stakeholders. Thank you.
Thank you very much, Gordon, for that insightful presentation. What is coming out strongly here is the issue of data that seems to be missing. Previously, Dr. Ageri talked about co-creation of ideas, and I think this also comes down to transdisciplinarity, because if we do not work with communities as far as ideas is concerned, as far as co-creation of ideas is concerned, then we are not able to come up with solutions that are customized to the needs of the societies or the communities that are usually vulnerable to the impacts of climate change. So I think that is very critical, and it also just points out to transdisciplinarity. I think what is really coming out very strongly again is that we will really need a lot of data as far as going forward, as far as managing this platform is concerned. But what I really would be interested to know is how we will be able to use GIS to map hotspots on climate-sensitive diseases like malaria or cholera in real time. And as this will actually help us in tracking outbreaks and identify correlations between diseases that are prevalent and environmental factors. So these are issues that we need to discuss further, just beyond the conference. But moving forward, we need to thank you very much, ladies and gentlemen, as far as that presentation is concerned. But moving forward, we need to move to the question and answer sessions. And the floor is now open for questions. Please keep your questions brief and related to the topic for today so that we can allow time for responses from our panelists. If you have any question, you can raise your hand or you can post it on the chat box. So I can see Patience already has a question there. Another question? Okay. It's a comment. If you have any question, you can raise your hand or you can post it on the box. But even as you wait for that, I was just wondering, Dr. Gavi, could you maybe share more about, there's a question? Michael has raised his hand. Michael, go ahead and ask your question.
Yes, good afternoon. One of the challenges we are having with climate data, especially in East Africa, is that some countries have made climate data, you have to pay for it for research. And this is one way that the meteorological services are raising money. That seems to be a bit of a challenge. I don't know whether there is any way there has been engagement in terms of payment for climate data, because that will be a big hindrance on the climate health charge research. I don't know how the situation is in Kenya, but I would suspect to access that, I think you pay for it. I know it's a situation in Uganda. I don't know how it is in Tanzania and other countries. I would be glad to hear the comment about payment for climate data in terms of climate health research. Thank you.
Thank you very much, Michael. Maybe Dr. Gavi, you could address that question about payment of climate data.
Yeah, thank you very much, Michael, for your question. And I actually feel you. The issue of data, yes, most organizations are selling data. And I know that could be attributed to maybe the issue of the infrastructure development. So they maybe charge maybe the cost they incurred in developing that infrastructure or the processing of that data into a form that can be usable by a particular stakeholder. And indeed, it is true that then if that element of data purchase continues, then it implies that most of these stakeholders will not have the data needed maybe to address a particular concern of what they are doing, be it research, be it policy, be it any other aspect of that particular data. The issue of Arin, the issue of capture that is has been developed, and we still continue to upgrade it. That is going to be a one platform, as we have said. We want to bring in some uniqueness because we are looking at that data that is localized, that we are going to collect even at the community level. Of course, we shall get this data through different approaches. And so because this platform is going to be co-created by different partners, then we shall again be able to sit together with all these partners to ensure that then we develop a framework that will see to it that those stakeholders that need this data then are able to access it in a manner that it will not be expensive, or it will not hinder them from accessing this data to make an informed decision. Thank you.
Thank you very much, Dr. Gaby, for that response. I can see a question on the chat box. Dr. Moses Chapa from Cambridge is asking, how does an individual organization get onboarded onto the CAPTCHA platform? And I think Anne will answer that. And his second question is, how would you validate data that Arin co-creates or other organizations generate to share? How would you validate that data that Arin co-creates or other organizations generate to share? And if you're not able to do that, maybe Dr. Taylor could help us with that.
So,
I did get that, Florence.
There's a question on the chat box, and it's coming from Moses Chapa from Cambridge. He asked, how would you validate data that Arin co-creates or other organizations generate to share? How would you validate that data?
I think just to comment, part of the CAPTCHA agenda, which perhaps has not been brought out clearly, is the aspect of engagement, where we are going to have CAPTCHA as a convening space where we bring the different stakeholders working on climate change and health to share, discuss, converse, validate, and learn from each other, and also connect, because the basis for CAPTCHA is transdisciplinarity. So it means we want the disciplines, the researchers working in different fields, the health researchers and climate researchers, meteorologists, including social researchers, to connect and begin to nurture ideas that really sort of creates a stronger connection for the sake of transdisciplinarity. So as we do that, we will have the opportunity to share the kind of data that is emerging and their sources. And in the context of stakeholder engagement, these stakeholders will be able to actually point the validity of the data or lack of it. So for us, the engagement is a very strong part of the validation. And of course, we have different plans as part of what we call the Arin mini grant schemes, which is targeting climate and health research in different African contexts. And these mini grants, these are small grants that basically are given to early career researchers to be able to pursue some empirically grounded research on climate change and health, but also in other fields. So through that, we will be able to do some ground truthing in certain representative contexts and be able to extrapolate to see the validity. But I guess institutions as a Cambridge Wellcome have long-standing databases that also will really form part of the conversation. So we will actually have engagements with some of these institutions with expertise in database development with regards to climate change and health. So it's a collective agenda, because we want CAPTCHA to be owned by the stakeholders so that it is interactive, it is functional in ways that can inform the knowledge needs as far as climate change and health is concerned, but also the policy needs within the continent as well. Thank you.
Thank you very much. Ladies and gentlemen, time is not on our side, so we may have to wrap up. There's a lot of information on our website. If you log into the Arin website, you'll be able to see a lot of information on CAPTCHA. So thank you, everyone, for your active participation and your thoughtful questions. And on behalf of the Africa Research and Impact Network, I would like to extend our gratitude to our keynote speaker, Dr. Taylor, and to our panelists, Dr. Gavin, Annie Rungu, and Mr. Gogo, for all your valuable insights. And a big thank you to all of you participants for engaging us today. We look forward to engaging with you this afternoon during our plenary session. Thank you once more.
Thank you, everyone.
Yeah, bye.
Thank you.
Thank you. Thank you.
To start off, my name is Jane Joroge, and I'll be the moderator for the session. I'd like to welcome each and every one of you. And our sub-theme will be the status of transdisciplinary research on climate and health and the impact in Africa. Okay, we're going to start. We have four panelists, and the hosts. Arin, can we proceed?
Yes, Jane, kindly proceed. Can you confirm if you can hear us from the side?
Okay. Okay. I'd like to introduce our panelists. We have members from SDI Kenya and also from Muungano wa Wanavijiji. And SDI is an NGO that consists of professionals that offer technical expertise that supports Muungano wa Wanavijiji, which is the social movement of residents of the informal settlements. And yeah, I'd like to introduce, we have Mike, who is the urban planner in SDI Kenya. We have Nancy, who is a member of Muungano, and also Jonte is a member of Muungano. And I'd like to introduce you to the topic, which is about ecosystem-based adaptation plans. And yeah, an intro on this ecosystem-based adaptation planning involves conservation, sustainable management and restoration of ecosystems, hence enhancing the resilience of ecosystems and communities against climate-related risks. The aim of this adaptation plan is to improve community resilience and adaptation to the adverse impacts of climate change. And to be able to achieve this, we were able to employ community-based participatory action research, which is a collaborative research approach that involves in communities and researchers working together to address health and environmental issues, which also encompasses climate change. And we were able to choose this approach because of its goal, which is to create relevant research by involving people who are the most affected by projects. And for all the projects that we do at SDI Kenya, we have the community at the heart of all the projects as we are developing solutions that will be able to help or to address their needs and their core mandate, which is housing, land, and services. And I'd like to list an outline of our discussion, whereby we'll list the challenges or the health challenges that affect the communities. Then we have the role that local knowledge or community knowledge plays in developing these adaptation plans. Then we'll have the intro of the ecosystem-based adaptation plan and the key aspects that were involved in developing this plan. Then we will have the transdisciplinary aspect about who was involved, the challenges and benefits of this, and how the community benefited from have transdisciplinary aspect in this project. Then we also have the community-led initiatives that the community were able to recommend or to put across to be able to address their specific and unique needs. And lastly, we'll have the impacts that these initiatives will have or already have to the community in terms of improving the health that was quite affected as a result of the climate change. And I'd like to introduce the first panelist, who is Nancy, to answer the first question or to give us a brief description or an in-depth perspective on the aspects of health. Could you kindly tell us the health impacts experienced by the residents and how they were able to, how climate change really affected them in terms of, generally health, mental well-being and physical health?
So, thank you, Jerry. So I'm Nancy Njoki from Mathare, one of the informal settlements in Kenya. So in the informal settlements, that's an area which is overpopulated. Yeah, it's like over 60% of the population in Nairobi lives in the informal settlements. So that means the houses are congested, they are built close to each other, we lack infrastructure, we lack the major amenities. So recently when it has been raining, it has been a big challenge to the community members. We've seen a lot of community members being affected by the flooding. So with the flooding, it came with a lot of diseases, having members of communities suffering from pneumonia, suffering from malaria, cholera. And also with flooding, We've had the issue of mental health. We've had a number of people who lost their properties, they lost their livelihood, they lost their houses. These community members, we have a good number of cases with people who are suffering from mental stress and disorders due to what the climate has caused. And also we have the issue of food insecurity. So with flooding, you've been working, you don't have a house, you don't have a source of income, you cannot be able to feed your family members, you're not able to feed your kids. So we have cases of malnutrition, we have cases of stunted growth in the community. And also we have the issue of when we have heat in the informal settlements, most of the houses are built with iron sheets. And these iron sheets, they are very close to each other. So when it's too hot, it's really hot, and really you get heat waves. So when you're in those houses, you really get sick, you really get dehydrated. So you get a lot of people are complaining of headaches, you have this, you don't know what is happening to you, you have fatigue. And also we have these areas, also most of the informal settlements are built next to the factories. For instance, when you go to Mukuru in Nairobi, so we have a lot of pollution. So there's a lot of pollution. So then you get a lot of respiratory infection. You have kids who are sick, people who are always in the hospitals. And also we have the issue of being in the slum, lack of infrastructure. So you get all other manner of diseases. So the community members really suffer because when you're in the informal settlements, there is no space for these services, so you lack infrastructure because there is no space. So you cannot access the health facilities. So if you have a respiratory disease, there is no facility. And if you have any other disease, you don't get facilities which are there to help you. So I also think just living in the climate aspect, when we talk about heat wave, it comes with fires in the informal settlements. We have a lot of fire. And it's really hard to put out a fire, especially when it is during the hot season. So people also suffer from these fires, people die, people get sick, people get injured, people lose property. So I think really the climate, this climate effects on the informal settlements, it's very high, and it's really a big challenge for our communities.
Okay, thank you for quite an in-depth overview of how health has really been impacted in the informal settlements. And as a follow-up question, I'd like to ask you, what do you think is the role of local knowledge, in building up to this research and in developing sustainable strategies and adaptation strategies for urban informal settlements? What role does the local knowledge play into building this research?
So I think the role of local knowledge is key to building this research. So with the community members, I think community members know what they want, know what issues are in the communities. For instance, so when it rains, the community members know where the river reaches with the highest flood. So it's really important to include these community voices when you are trying to bring up any strategy which will be able to assist and intervene in these issues. And also the community members, they have their own ways of solving issues. For instance, if you go to the informal settlements, when it is rainy season, the women there, they put stones to lift up their buildings. So they have their own local strategies on how to deal with these issues. They will put stones, they will clear the stormwater, they will clear the drainages. So the community members they have a role which they play, which will really help. And also just including community local practices. Yeah, you have areas where community members who are living near the rivers, they put soil in the sacks. So this is really key. They know what they will do. They will put soils in the sack, and this will prevent erosion. And also recently with our groups, we have groups which are doing climate actions. These youth groups are doing their own initiative. They are planting trees, they are cleaning the rivers. So I think these groups, because our government is having an initiative of cleaning the river, it's high time where the government can include these youth groups so that they can be able to continue the work they are doing. cleaning the river, planting the trees, and this will lead to sustainability. So I think just having the community at the center and having the voices of the community and just engaging the communities fully will play a big role in developing this adaptation strategy for the urban informal settlement.
Okay. Thank you so much, Nancy. As from her account, you're able to see the research problem that actually guided us to be able to develop these adaptation plans, to be able to address these challenges that you're facing. And we can see how we can collaborate with you to come up with initiatives that can actually work in the long term to build on resilience. And based on this problem statement, I'd like to welcome our second panelist, Mike, who's the planner at SDI Kenya, to give us an introduction into the ecosystem-based adaptation plan and to tell us what were the key aspects involved in developing this plan and how these key aspects will help to, to address these challenges that Nancy has stated.
Yeah, thank you, Jerry, and also thank you to my fellow colleagues for that elaborate discussion. So when we are focusing on the ecosystem-based adaptation plan, first of all, we should be able to understand that with the climate change language and the impacts of climate change, we as people who are residing within the global south have been adversely affected in the recent years. So with the global south countries being affected, Kenya is one of the countries that has been greatly affected by the climate change. And when you're talking about the climate change and what contributes to the climate change and what are the impacts of the climate change, they should be the key factor when we are trying to develop these particular plans. Just as Nancy has said, is that most of our informal settlements in Nairobi, they have been affected by increase in temperature and also with the increase in flooding situation within these particular areas. And one of the recent challenges that have been encountered within our informal settlement that houses close to 70% of the total population is flooding. And when you're talking about flooding, you should be able to come to realization that the systems that we currently have within the city, they can't be able to sustain the amount of water that the city receives due to climate change during the long rains. And such system was seen as broken system during the March long rains within Mathare Valley, being one of the informal settlements in Nairobi as a city county. And when we're talking about the ecosystem-based adaptation planning, I think the most important thing that we should be able to focus on are systems trying to work as a whole. We should not be looking at system working as a silo, but these systems needs to be brought together. And with the ecosystem-based adaptation planning, what we'll be looking at are ways in which we can work closely with the community members to be able to restore and to revitalize the natural system that they currently live with. When we look at close to 126 out of 148 informal settlements within Nairobi City County, they are situated in areas that are being traversed by the main river reserves. So those main river reserves, they include the Mathare, they include the Nairobi, and also the Ngong river basins. So we need to create a mutual way in which the community or the residents residing within this particular informal settlement, they can be able to relate to the natural system. And when I'm talking about the natural system, I'm talking about the rivers. So how can we be able to improve the levels of adaptive capacities of people who do reside within this particular informal settlement, while on the other hand, looking for ways in which those residents, they can't see the rivers as a liability to them, so that we can be able to transform the rivers to be an asset to them. Because when you are talking to some of the old guys that do reside within these particular areas, they were telling us that in the past 30 years, the river had a lot of benefits as compared to nowadays. Why? Because the river has been deteriorated within a period of time. So one of the contributors to the deterioration of the rivers within Nairobi as a city county is based on our planning approach. Prior to 2010, most of the plans that we were developing within Nairobi only focused on the physical, social, and economic aspect, neglecting the environmental bit of it. And that is what we are trying to correct with the community members. How can the community members be able to work with the professional to develop an ecosystem-based adaptation approach that also looks at the environmental bit of planning? So some of the key aspects that we've been looking while developing the ecosystem-based adaptation plan, the first one is being derived from the Kenyan Constitution, the preamble bit of the Constitution. The preamble bit of the Constitution usually talks about the people. How can we be able to put the community members to be at the central stage during preparation of these particular plans, and to make sure that most of the community members, they are involved during the plan preparation exercise, because they are the ones who do encounter the challenges that are being imposed by the climate change. And if they do encounter those particular challenges, they're the ones who do have solution or the keys to those particular challenges. Then the second aspect that we usually do consider is initiation of the planning process. When initiating the planning process, we usually use the multi-sectoral approach. How can we be able to accommodate different departments during our planning approach? And then the third one is based on the risk and vulnerability assessment. So with the risk and vulnerability assessment, what we usually do, we usually identify the community mappers that are able to map out some of the risk and vulnerability within their area of location, and also the community members that and also make sure that the community members are able to give us views in relation to the vulnerability that they do encounter within the area. And the fourth aspect that I think is the most important aspect, it relates to the bottom-up approach. And when I'm talking about the bottom-up approach, this aspect relates to the visioning exercise. How can we be able to put the community member to be at the central stage of trying to propose some of the adaptation strategies that can be implemented within that particular area? And if you are able to get that right, it's when we'll be able to proceed to an ecosystem-based adaptation plan that restores the riparian resource.
Okay.
Thank you.
Okay. Thank you so much for that in detail account. And I'd like, based on the aspect that you've listed, we have the second aspect and the fourth aspect on the aspect on multidisciplinarity and, involving other stakeholders, including the community, in actually achieving these adaptation plans. And I'd like to ask you a follow-up question is, how can researchers, policymakers, communities, and other stakeholders at large better collaborate to address climate resilience in marginalized communities?
Yeah, thank you, Jerry. I'm talking about climate resilience and also climate adaptation. I think one of the things that we professionally have been trying to mix for a long period of time is way in which you can be able to accommodate community knowledge, some of the community practices where we are generating this particular plan. And the plans that we are supposed to develop, they're supposed to be plans that are able to solve the problems that are being encountered within the communities. And some of the strategies that can be able to lead to better partnership with the researchers, the academics, and also the community, they include participatory mapping and planning. When you're talking about participatory mapping and planning, this is an exercise in which the community members, they are being placed at the forefront of mapping some of the challenges that they do encounter, and they can also be involved in the co-designing and the co-planning of some of the adaptation strategies within their area. And another important strategy that I think we should be able to look into is in relation to communication. When you go to the climate change workshops, or if you organize workshops within the community areas, one of the challenges that we've been encountering is in relation to clear communication. So right now we're talking about ecosystem-based adaptation planning. But if you go to an informal settlement, the way in which that particular person that do reside within an informal settlement will be able to understand the ecosystem-based adaptation planning is totally different. Why can't you be able to tell them that we are looking at local solutions that are able to lead to solving some of the environmental solutions that some of the environmental challenges that they're encountering within the area? I think we should be able to simplify these particular terms so that the community members can also be able to understand them not in the same capacity that you understand them, but they can be able to understand them to a certain extent. Another important bit or strategy of it is in relation to capacity building and training. Just like Nancy has said, that we as Muungano wa Vijiji and SDA Kenya have been working closely with the climate action groups that are currently operating along the Nairobi river basins. So how can we be able to train these particular groups so that they can be able to scale up some of the best initiatives that they have been able to showcase within their areas of operation, such as in the case of the Comgreen Group, which are doing a good work in Korogosho area. And also another important area that we can be able to bring in the community, the researchers, and also the academia is in relation to inclusive policy framework. I think we should be able to concur with each other that when we are looking at the vulnerable groups, where they are located, there are areas that do have different complexity. How can we be able to bring these particular groups so that they can be able to propose some of the negotiated planning standards that can be able to restore some of their river basins or the riparian results? Yeah. Thank you.
I think a unique aspect that maybe you can touch on a little bit is how you've been able to involve county officials to be able to ensure that we have goodwill and buy-in, enough buy-in from the government to ensure that our project actually goes forward.
Yeah, just the way I said earlier that with the ecosystem-based adaptation planning, it usually requires a multi-sectoral approach, trying to bring different sectors into this particular play. As most of you are aware that we can be able to generate the best of the best plans, but without the support of the county government, those plans can't be implemented. So what we've been trying to do as Muungano wa Vijiji is to bring in the county government, different departments in our planning process, such as in the case when we are preparing the plan for Kiamaiko ward adaptation planning, we're able to bring in the county government to assist the community in the visioning process and also trying to identify some of the challenges that they're encountering within that area. With bringing in the county government through our process, it has with bringing in the county government through our process has been able to streamline some of the activities that we are currently having within Madare Valley, and it has also been able it has also been able to create a nexus between us, ways of operation with the county government that I think can assist with the plan approval and also the plan implementation in that particular area.
Okay, thank you so much. From the account from Mike, we've been able to see how transdisciplinary approach has been able to impact our project and ensure our buy-in and moving forward of the project and getting approvals. And from this, we were able to identify, also in collaboration with the community, some community initiatives that they have been able to do in terms of restoring and ensuring building of climate resilience. And I'd like to ask the next question to my panel, Maya Jonte, to actually tell us how to maybe elaborate on the community-led initiatives that have led to health improvements in the informal settlements and what you've been doing there. And yeah, just give us a brief account on that.
Yes, thank you very much, Jane. And I think, as Nancy said, that Nairobi, the largest population, 60% comes from the informal settlement. And informal settlements, we have been attached with so many probably negative aspects, being crime, unemployment, drugs, and all sorts of that. So from there now, we have community members who now try to set up kind of a livelihood. And one of the livelihoods that they set up, the only space that they have is the green space. And the green space is now the river restoration and probably waste management, whereby now the young people flock to find to set up kind of an employment structure. At the same time, now working on the river restoration and waste management, but not even connecting that they are doing, maybe they are promoting climate change. Until now where we connect with the other civil society organization to tell them that now what you're doing is related to climate change. And if you look, so many groups, especially the waste management groups, the river restoration groups, if you go back to their background, most of them are ex-convicts. And now they try to to make sure that the informal settlement try to change their perception in terms of what we have said earlier by now bringing other activities that will promote climate change. But on the end, they are looking at livelihood. And for that purpose, that's why now we try to bring the community together through those groups and try to move at a step from one step to another, aligning all what they are doing in relationship to climate change, at the same time promoting the health within our communities. If you look, I was reading an article, I can't remember the article for reference. I was reading an article whereby Ghana promoted to have 85% of clean water within their country. So meaning that if they have 85% of clean water, they've tried to mitigate so many things in terms of waterborne diseases. They've tried to mitigate in terms of water rationing, of which now we are experiencing from our informal settlement, whereby we have those kind of setbacks like water rationing. If, for instance, there is a settlement where called Ghetto, they receive only water for like 2-3 days in a week. And for those 2-3 days in a week, meaning the rest of the days, they have to survive with different means. And surviving with different means, meaning that they will have to encounter so many challenges. And that's why now Ghetto is in Kiamaiko. And when there is a cholera outbreak, that's the first settlement that always report those cases. And then now when they report those cases, then they have to look for a health facility, which health facility in Kiamaiko that we normally understand that public health facilities in an informal settlement, sometimes they don't respond to our needs. And when they go to those health facilities, then they get only minimal services, probably like only lab technician, and then they are told to seek services like pharmaceutical services somewhere outside, of which becomes costly. When I come to the waste management, especially the pollution, there is several set of pollution. There is air pollution, at the same time there is solid waste management pollution. So in our informal settlement, the setup that we have, that what I've said earlier, the young people are looking for livelihood, but they don't care where probably they take their waste. So they just walk around and probably take their waste from the household to just a nearby collection area. And the collection area, whereby now the county county officials who are supposed to have mandated to collect that waste, they lack some of the facilities or maybe facilitation to make sure that the waste is collected in timely. And that now poses a health hazard within that particular community. Sometimes you find that neighborhoods, sometimes you find their schools, there are other facilities within that compound, but now the facilities can't operate well because of probably the air pollution and the waste pollution that is in that particular area. And then we realize some of the cases reported to the nearby health facilities, especially the diseases, are related to those kind of, they're related to the waste that is being dumped at that particular space. So now we are trying to link the livelihood the youth are doing, at the same time making sure that they're in line with the policies, and even giving now the duty bearers or maybe the person responsible a responsibility to make sure that they account for everything that's happening within that particular community, so that we can have a healthy community. The other challenge is the risk and disaster management that I think in our informal settlements is not that strong. And if it's strong, probably they just do on a voluntary basis, whereby nobody, even no one, recognizes their efforts. At the time, let's say when we experienced floods in Madare, so many young people came out to rescue their community members. And when they came to rescue their community members, we just only praise them at that particular moment, and then now it's gone back to our normal livelihood. We forget that we probably may experience another disaster coming years. So we are not prepared for any disaster in terms of setting up kind of a team, or maybe recognizing people who can respond to those disasters, the logistical area of those responding to those disasters. And then we realize from that angle, we are incapacitated as a community to make sure that we respond to anything. And at that particular moment, you realize that on a health aspect, as a disaster management, there are so many things that are so related that you can't even we can't even support, we can't even support ourselves. Then maybe final issue is the population density, probably not matching the services rendered by the relevant institution. So in the informal settlements, that's when I find a huge number, or maybe a large population of people living in the informal settlement, sharing maybe having a 10 by 10 structure houses, as Nancy mentioned, the mabati or the iron sheet houses, and probably sitting on a very small space of land, but having so many houses, whereby they have very inadequate services like sharing one ablution block, maybe sharing one tap, or maybe one water point, and servicing like 100, one spot of water point servicing like 200 people. So when you find that kind of services, then you realize that there is some risk and dangers in regards of responding to any kind of crisis, be it health, be it disaster. So I think from there now, from our role is making sure that we ride on, not riding on, probably bringing the community together, sharing those ideas, issues, challenges, and then now packaging them together as a community through vulnerability mapping, the visioning process, and unpacking every challenge, and then from there now trying to come up with ways and people that will engage for this particular process.
Okay, thank you so much. And maybe as Nancy had stated that we have climate action youth groups that are maybe working on river restoration of maybe Madare River, Gitaduru River. Can you maybe just give us an account of how the youth groups have been able to carry out the river restoration, and how this handling of this waste and restoring the river, how it has been able to improve the health of the communities? Yeah, you just tell us.
Yes, thank you again. So last year and last year back one, we mapped several community groups that are working on river restoration. And for that, we didn't leave those who are working on waste management because they're interlinked. Not necessarily that we are maybe on the riparian space, but within the community, then those who are on the waste management probably might affect the ecosystem through their waste, because we don't have adequate space where you can do collection points. So most of the youth were taking their waste to the river. So then now there was kind of a conflict between those who are trying to restore the river and those who are doing waste management. So it was our role and our mandate to make sure that we come in as community, to make sure that we bridge this gap and then come up with a way or a system on how to work together. And for that particular process, through the project that we are doing, the VCA project, within 2 cities, we mapped around 563 groups in Nairobi and Kisumu. And then for Nairobi and Kisumu, last year, we engaged 200 youth groups that are within Madare River. And 200 youth groups that comprises of the waste management groups, the river restoration groups. And then we held a very huge meeting with the NRC. That's where now NRC came on board and then divided the Madare River into zones. So recognizing that the youth are working in different zones. It's so unfortunate that we experienced floods that affected their projects. At the same time, now the recent demolition that affected their projects, but some of the groups haven't given up. They're still fighting back in regards to whatever took place. They experienced a lot of loss, but at the same time, they are still resilient. They believe in that cause of probably fighting for their nature. And for those groups, some of them, those were kind of a livelihood, whereby they just wake up in the morning, they show that, they believe that they have pigs to feed, cows to take care of, they have probably maybe the river to clean, the trees to care of. So it was kind of a routine. And from that particular process, when they understood that whatever they are doing is related to climate change, and then now they put it, they kept a very high gear so that they can make sure they achieve, we achieve all, from the government, from the youth, from the community. And for those community groups, at this particular moment, I think we have a facility that's still supporting those community groups, the VCA, the next level grant facility. Since we realized that some of the gaps, maybe they are funding, some of the gaps were capacity, some of the gaps were even in the internal relationship and even the external relationship. So as a federation, we came in to make sure that we bridge those gaps by making sure that those who don't have the capital to run certain programs, they can apply to us, and then given that support. So, and then at the same time, those who didn't have capacity, they can be trained on various aspects like financial management, leadership and governance, so that they can know how to relate with the locals and the other community members.
Okay, thank you so much, John. As from all the accounts given by our panelists, we've been able to identify the problem statement from the community that of the needs that we were addressing, and also the adaptation plan and how it came about and how it's going on, and also the community initiatives that are being carried out at the moment. Currently, I'd like to inform you that this project is ongoing. It's not yet complete. We're working on some of the challenges. For example, the demolitions really cut back on on our momentum, but we are navigating through that even now. But yeah, that's the state of our research and the adaptation plans. And I'd like to open the floor to questions and answers. Yeah.
Thank you very much, Jane, and the entire SDI team for that.
Are there any questions? Probably. Let me check in the chat whether there's some questions that have been posted. Okay, we have one question from Jonathan that asks, how are you documenting all data and information related to the identified adaptation pathways of community members in those localities of climate change? I don't know, maybe one of our panelists can answer that. Maybe Mike?
Yeah, thank you, Jonathan, for that question. One of the ways in which we've been able to document some of the achievements that are being done by the youth groups and also some of our adaptation efforts are in relation to within our organization, and also working closely with Muungano and Vijiji. We have the Know Your City television channel. So with the Know Your City television channel, we are able to capture real and up-to-date data in relation to some of our efforts that we've been having within Mathare Valley. And also another way in which you can be able to access some of this information is through using the Muungano.net. Through the Muungano.net, you can be able to access some of the documented work in relation to our efforts within our respective communities. And also, us as SDA Kenya, working closely with the Muungano and Vijiji and trying to build the capacity of youths within Mathare Valley. What we've been able to do is to train some of the community members in ways in which they can be able to take some of the hard copy notes and can also be able to share with some professionals and also our organizations in terms of adaptation efforts within our area of location. Yeah, thank you.
Maybe addition.
Yeah.
So as for now, I think as Muungano and Vijiji managed to train around 105 youth across 3 cities, that is Nairobi, Naivasha, Nakuru, and Kisumu. And for that particular moment, the young people come from those communities, and especially in Nairobi, whereby you have those community members, whereby they realize those are part of the challenges when they come together. When they come together, and then we identify potential of young people who can help us tell our own stories. We don't just document purposely for only sharing, maybe sharing the, not purposely just documenting just to be kept on the website, but at the same time for the community to understand what we are doing, and even the community members can share our own stories without even maybe being pushed by a particular person to do so. So it's kind of a passion and a voluntary process.
Okay, thank you for that response. We have another question from Ivan. How do you validate data from government sectors, and how do you proceed where there is unavailable data as far as climate is concerned?
Yeah, so working within informal neighborhoods, so one of the most important things is to be able to acquire the hard data And once you've finally had data, what you're supposed to do is to be able to create the rich stories out of those acquired hard data. So in some instances, because the informal settlement, these are areas that do operate in terms of complexity. Some of these particular areas, the government don't have up-to-date data. So what we've been doing as Muungano and Vijiji, we've been able to train a number of community researchers that can be able to assist us in collecting the up-to-date data in relation to risk and vulnerabilities that are being encountered within those particular respective areas.
And also we do have community forums where each data collected is validated by the community members.
Okay, that's really nice. Also, we have a question from Jonathan. What climatic risks have you identified in informal settlements within the urban setups? Maybe Nancy or Jonte, can answer.
So Nancy, I think Nancy mentioned some of the climatic risks, being the heat wave, flooding, probably the issue of waste management. And I think when you talk about waste management now, one of the biggest challenges is the fecal or maybe the solid waste. That's now being a very big menace in our community. And probably in that aspect, we only mention it as environment, but it's a very big, huge climatic challenge. So the other thing we can say is about even disaster response. It's still another challenge, because if there is a crisis like flood, if there is a crisis like fire that has been brought by heat wave, how do we respond to that challenge, despite now having a very populated settlement with poor infrastructure, for instance, roads, to do kind of response. So Nancy,
and also we have this air pollution from factories. So they have air pollution and also they pollute the rivers. Also, we don't have trees which are there to capture this pollutant from the factories.
Okay, thank you so much. I think that is the last question that we received from the chat. Maybe if anyone has a question from the audience, we are free and open to further questions on that. Maybe you can just raise your hand or unmute.
The question, I think they did get us.
Okay. I don't know how to go about the communication aspect.
Based on our submission today, I think one of the most important things that we should be able to look into or to be able to break the ice in relation to built environment and also the urban axis that have been able to be created within our urban setup. Because looking at it and with the previous planning reports, they were based on ways in which they can be able to improve the built environment, while on the other hand, they were looking at ways in which they can be able to create the site vistas within our urban neighborhoods. And the planning nodes used to play an important role of trying to connect one area to another. But we as people within the built environment and also working closely in the climate environment, one of the things that we should be able to think of is ways in which we can be able to reclaim and also rehabilitate the river reserves so that they can be used as the development corridors of the city, so that the river can also contribute to the city, but not the river only contributing to be a liability to the city residents. I think with that one, we'll be able to get the work done. Thank you.
Okay, thank you so much, Mike. I can see some positive responses from the chat. Maybe if that is the last question, maybe I would like to hand over to Arin, to give us basically feedback.
Thank you, Jane, and thank you, the team, the SDI team. I really hope that you can hear us now. Probably, I think there's an audio problem, and hoping that you can hear us at some point. But we just want to really appreciate that wealth of conversation that's coming from your side. So many aspects that are coming out from the work that you do, the initiative that you're taking on, that is highlighting the problems, the challenges that the communities in the informal settlements face, and which is one of the basic principles that I think pointing out to the climate and health conversation that has begun today in this 3-day conference that we want to kind of explore. And I'm very much happy to see that transdisciplinarity afternoon, good morning, or good evening, based on where you're joining this session from. My name is Victoria Chengo from the Africa Research and Impact Network. I'd like to welcome you to this main session of today, the 4th annual conference. And this year's theme is on climate and health. And this is the main session for today. We've had 2 side events in the morning. The first one, we were launching the Capture platform where which we have consolidated as Arin to put together the data on climate and change and trying to link up the various people or sectors, organizations that are working on this area. The second session was looking at a case study by the Slum Dwellers International that are working on an ecosystem-based adaptation planning in restoration of urban informal settlements. So initiatives that were very insightful to understanding the issues facing the urban informal settlements in terms of climate and health. So in this main session, we want to look at the status of climate change and health research and the impact of this in the entire continent of Africa. But just before we proceed, I would like to just welcome you once more and request you to introduce yourself by texting your name, your affiliation, and possibly where you are joining this session from, just to get to know who is in the room, and possibly your contacts if you'd like to connect with other like-minded people across the continent and the globe as well. And we would like to request you to stay muted if you're not speaking. If you'd like, if along the conversation you have a question that just comes up to mind, just type it in the chat so that those that can respond to you can prepare accordingly. We'll try to address that towards the end of the session. This is a 3-hour session, so we hope that you will stay tuned all along and the conversations will be exciting enough for you all along. So I want to introduce or just usher in my colleague, Dr. Agevi, who is going to chair the session of today. And thank you, and again, welcome to the session.
Yeah, thank you very much. Good morning, good afternoon, good evening from where you are joining us. We humbly appreciate you are joining this particular conference that Arin is hosting as the 4th annual international conference. And as my colleague has said, this year's theme is on climate and health. And our theme this year is bridging the knowledge gap, where we are trying to promote the aspect of transdisciplinarity for climate and health resilience. This conference is going to underscore the need for collaboration among diverse sectors and also across different levels of government in the way they try to tackle climate crisis and its effects on the health outcomes. The conference is also just trying to call for a shift from the normal silo approach of research And we understand that when it comes to silo approach of conducting research, it has quite a number of limitations that we know of. For example, that it really brings about what we call fragmented understanding of the effects of climate change on health. It also brings about what we call ineffective policies because there is no data that will guide on how different governments can make good policies. We also are aware that this siloed approach also hinder the capacity building, and that is why we are calling for transdisciplinarity in terms of research. Because through this, we understand that we are going to develop a sustainable and effective solutions that can help in building healthier and more resilient communities globally. And we are happy that this conference is being attended by people from everywhere in the world. So we are going to share best practices that are being practiced in our country. And this can also bring about some key learning that we can be able to learn and be able to upscale even in our respective areas. This conference, this plenary session, as a session that is the third session of the day, is going to look at the issue of, we are going to begin with the keynote speaker, where we shall have a discussant that will bring in some perspectives on the issue of transdisciplinarity when it comes to research in climate change and health. And then from there, we shall have the case presentations where individual researchers will be showcasing what they have been doing within their geographical regions. And then after that, we shall have a panel discussion that we shall invite panelists that will just try to discuss some of these issues around our thematic area of day one, where we are looking at the status of climate change and health research and its impacts in Africa. Welcome so much. To begin with, I want to invite our Executive Director, Dr. Johannes Atela, just to give some welcoming remarks. Welcome, Dr. Atela.
Thank you very much, Dr. Gavi and Victoria, for the welcoming remarks to our participants who have joined us today. On behalf of the Africa Research and Impact Network, I want to take this opportunity to welcome all our distinguished participants, partners, colleagues, friends who are joining this year's Arin 4th International Conference, which is focused on the theme around bridging the gap or bridging the knowledge gaps and promoting transdisciplinarity in climate change and health research and action in Africa. We are privileged and very humbled to host you and to engage you in this very complex conversation. As you know, the Africa Research and Impact Network is a Pan-African think tank based in Nairobi with the mandate of consolidating evidence from the different African contexts and using this evidence to be able to support integrated solutions towards complex challenges that the continent faces. At the same time, the Arin network brings together about 200 researchers and policymakers from across 36 African countries and the diaspora. And with that particular connection, we also provide a space for sharing some of the best research and impact practices that are taking place in different corners of Africa. And this is with the agenda that we would like to make some of the transformative research that is taking place in the continent to be much more visible to the global space and to be much more visible to the policy processes so that their usefulness can be felt in the policy and action realm. I want to say that climate change is not just an environmental issue, but it's becoming a major cross-sectoral issue. And in terms of the impacts of climate change and health, it is no longer a one straight issue or a narrow issue around how climate change events affect health conditions. It is becoming more of a multi-sectoral issue, in the sense that a lot of the health determining sectors, whether energy, whether water and sanitation, whether agriculture and nutrition, are actually directly or indirectly affected by climate change. And therefore, it is not really adequate, or is not sensible to look at the climate change and health issue as a sectoral issue or a health issue. But we need to look at this from a multi-sectoral perspective. Our distinguished participants, we know that the climate change impacts are widely documented, and we look at the health sector. There are increasing prevalence of climate-sensitive diseases to the disruption of food security, energy, and water system. And we are witnessing unprecedented effects on the social determinants of health, with the most vulnerable populations bearing the brunt. These growing challenges require urgent multi-sectoral responses, as I've mentioned, and these multi-sectoral responses should transcend the traditional boundaries of individual disciplines. This is very critical because we know that traditionally health and climate change communities and stakeholders, researchers, policymakers have actually pursued their activities in silos. So we have a well-developed health community with health researchers doing excellent research on the impact of heat on mental health, floods and vector-borne diseases. On the other hand, we have a well-developed community, experts and researchers, and of course, policy systems in the climate change realm. But the connection between these particular two fields in Africa, has been a bit weak. And that has led to a lot of siloed approach to addressing the complex challenge around climate change and health, as Dr. Gavi has mentioned. And indeed, over the past few years, there has been a renewed focus globally on integrating health considerations into climate change decisions. Initiatives such as the World Health Organization's Alliance for Transformative Action for Climate and Health, ATTACH in short, and the health national adaptation plans that result from this particular ATTACH, as being prepared by the many countries within Africa and elsewhere. All these are a testament to the momentum gathering around the integrated health and climate change actions. However, despite this promising shift, health considerations remain insufficiently integrated into the climate change policies. As we speak, ladies and gentlemen, and our distinguished guest in this conference, only about 0.5% of multilateral climate adaptation funds are allocated to health sector in Africa, for instance. This is a stark reminder of the underfunded and underdeveloped collaborations between researchers, policymakers, and implementation partners on this continent. Ladies and gentlemen, and our distinguished participants. The Africa Research and Impact Network's work on climate change and health has been instrumental in advancing these efforts. This particular conference marks a pivotal moment as we share insights from some of the work that we have been doing, including Wellcome-funded study that we recently concluded and was focusing on consultations on community of practice for transdisciplinary research and action on climate and health in Africa. These particular initiatives that we undertake as Arin aim to change the narrative and aims to bring a transformative agenda where experts, disciplines, policymakers, sectors, stakeholders from different spaces begin to work together to address the complex challenge around climate change and health. Through a robust analysis of regional stakeholder consultations and transdisciplinary research, we, in one of the studies, identified innovative models of collaboration that can be scaled up to strengthen the integration of health and climate change policies. In our studies and evidence that we've generated, we've also highlighted some of the potential of community of practices that can be built to bridge the gap between knowledge generation and policy implementation, fostering cross-sector collaboration to drive health resilience in climate change efforts. We believe that transdisciplinarity is a critical foundation for this innovation, and hence the gist of the foundation for this particular conference. Bringing different sectors together, different disciplines and stakeholders actually holds the key to finding holistic, inclusive, and sustainable solutions to the intertwined challenges of climate change and health, as well as is crucial for addressing these complex socioeconomic realities that underpin this issue. Therefore, ladies and gentlemen, our distinguished participants, this conference also provides a critical platform for the exchange of groundbreaking research, innovative ideas, and policy solutions. As you will see, we have a number of case studies that are lined up, from different works or different research that are taking place in different parts of Africa, and a number of our early career researchers will be presenting this during the conference. Again, we also have some of the exciting side events that are also bringing in experiences from different parts of the continent. Our goal is therefore to foster deeper collaboration between sectors such as agriculture, energy, environment, and biodiversity, among others, all of which intersect with health in the context of climate change. At Arin, we are committed to promoting research excellence and dialogue, providing platforms for the science policy interface, and advocating for the knowledge and innovation that Africa offers. Our network is composed of 200 researchers and policymakers from across 36 African countries. And as I've said, this provides a very strong foundation upon which evidence, empirically grounded evidence, can be generated, transmitted to policy decisions, but most importantly, made visible to the world so that investments and interventions can be targeted. And therefore, as we embark through this 3-day virtual gathering conference, I urge all researchers, policymakers, practitioners, community-based organizations, funders, and other key sectors to seize this opportunity to push for the boundaries of collaboration, move beyond siloed approaches, and explore how we can collectively shape a future where climate and health resilience is not just an aspiration, but a reality for all. Let this conference be a catalyst for change, where knowledge gaps are bridged, new partnerships are forged, and transdisciplinary approaches become the standard for addressing climate-related health challenges as we contribute to the strengthening of the public health resilience by advancing evidence-based policies and bolstering capacity building and enhancing innovative initiatives. And therefore, with those very few remarks, ladies and gentlemen, we do look forward to a fruitful discussion, impactful presentations, and most importantly, as I've mentioned before, new partnerships that will drive the climate and health agenda forward. Once again, on behalf of the Africa Research and Impact Network, I take this opportunity to welcome you to this exciting 3-day conversation that we hope that is going to help us progress the discourse around climate change and health in the continent. And most importantly, we must be ready in this particular conference and discussion. We must be ready to ask and answer the difficult questions. Complex challenges like climate change and health cannot be solved or cannot be approached by simplistic, traditional, disciplinary approaches that we have seen not to work in many cases. We therefore know that this is a challenge. It is not very easy for many of us who have grown and been nurtured in specific disciplines. But I do believe that starting this conversation is the most important step so that we are able to really confront this particular complexity. And therefore, once again, thank you so much. And we look forward to your productive engagement in this process. Thank you. And back to you, Mr. Chair.
Thank you very much, Director, for your welcoming remarks. And clearly you have elaborated the need for the paradigm shift from the siloed approach to the transdisciplinary research that will indeed provide effective solutions to the global problems of climate change and how they impact on health. Now, to begin us, we are going to begin with Professor Nishad Jayasundara from Duke University is our first key discussant. Professor comes from Duke University. He is an assistant professor and he has done some research, some long-term developmental research on exposure to chemical and physical environmental stressors. And based on his experience in that particular area, we want to bring this discussion here by asking this question that he is going to address. That, Professor, that when you look at the experience you have with the research you have been doing, and I know with the global travel you have made, and I know with the stakeholders you have met, in your view, is there any strong presence of transdisciplinary approach in trying to address climate change and health? And maybe just to add on that, maybe you could also just provide key insights by looking at maybe what then could be some of the opportunities that do you suggest we can use to enhance such collaboration when it comes to research in climate change and health. Welcome, Professor Nishad.
Professor, you're muted. Sorry.
Sorry. Yes, thank you so much for having me. I hope you can see me okay, hear me okay. And also, I prepared a few slides to share with everybody. I hope that's okay. And hopefully you can see my slide set as well. Can you see the slides or?
You had them up, but now we cannot see them.
Oh, I'm sorry. Is it working now?
Still, yes, we can see it now.
Okay,
yes.
Perfect. Sounds great. And this is an incredible discussion just from the little bit I already heard. So really honored to be invited and to be able to share some of my perspective on are we seeing transdisciplinary approaches in this climate and health space, and what are the opportunities that we have for enhancing research and collaboration. So I'll share a little bit of that. As the chair said, I'm an assistant professor in global environmental health at Duke University here in the United States. It's an interesting day today after the elections. I'm part of the Duke Global Health Institute, which led me to be in Kenya this past summer, and we are now starting some work there, which I'm really excited about. But beyond that, I should confess that I've had very little work in the continent itself, although I've done work around the space around the world in several other places. So I'll try and share my perspective from that experience. What I want to do is to give you a brief overview of the work that we are doing and use that as an example to show how we are seeing transdisciplinary approaches emerging, and then think a little bit about what opportunities we have in enhancing research and collaboration, especially in the context of the African continent. But I first want to actually quickly note that I grew up in Sri Lanka. It's a small, quite beautiful, and I'm not biased, island in the Indian Ocean. And since then, for the last 25 years, I've been living in the US and traveling to multiple places. And where I grew up, I basically spent my whole life in this little creek that you can see. That's my backyard. And this used to be full of life. And I spent so much time trying to catch fish in this creek and many other things. And over time, my family and other families in our village, they've changed this creek in a way that we've lost that life in this creek. And this is, I think, a really striking personal example of how we've changed the environment around us and how climate change might be even intensifying these changes that we are seeing. And this experience really, I think, forms the foundation for the type of research that I do at Duke and my research program. And just to show you a bit more on that is everything we're seeing is that climate change is intensifying already existing health risks and also leading to new and emerging health outcomes. And my group is focused on understanding how these types of environmental changes are leading to these adverse health outcomes, both in people, but also in our wildlife around us. And obviously, this is a question that it's been studied for centuries across the world. And it's becoming even more relevant, obviously, with climate change changing both our environment, but also our own physiological response to our environment because of things like heat exposure. So we know that climate change itself has health risks and it's intensifying, and it's becoming a health risk multiplier for communities that are already burdened from multiple environmental and socioeconomic pressures. And these vulnerable communities are in many ways at the sort of forefront or the frontline communities that we should really be thinking about. And those communities exist in Sri Lanka, in Asia, and I'm sure they exist in parts of Africa and South America, and also in the countries we typically consider the global north, but we also see that even in our own backyard in North Carolina here. So a really striking example of this, this intensifying effect of climate change is captured in some of the work we are doing to understand this rise in a very peculiar form of kidney disease. And I think we all know what our kidneys do and where they are. And what we're seeing is that there's a global increase in chronic kidney diseases of non-traditional origins in the world. And primarily this is emerging in farming communities. About 90% of the people that are seeing this increase in kidney disease prevalence is living in a farming community. About 60% of them are farmers. And to give you a little bit of numbers, about 1 in 3 men are in end-stage kidney failure. So they don't really have any other option at that point in this one community in Nicaragua. There's one community we worked in Udanam in India. About 60% of the men have failing kidneys. There's about a 5-fold increase in the number of people dying from this kidney failure in Nicaragua and El Salvador over the last 20 years. In Sri Lanka, we are seeing about 20,000 people at this end-stage kidney failure who are just essentially waiting for a transplant, which is a highly unlikely outcome in these scenarios. And we call this disease in several names, CKD, or chronic kidney disease of non-traditional origin, or CKDU, chronic kidney disease of unknown origins. So I may use the word CKDU for a bit. And just to show you the global prevalence, we're seeing this in many countries in South America, in Mexico, Guatemala, El Salvador, Costa Rica, Panama. So this is the tropics of Mesoamerica, right? And we're also seeing this in India, Sri Lanka, and we are now beginning to see evidence of this in several states in the United States. We're also seeing this emerging in Southeast Asia, in Thailand, Cambodia, and Vietnam, and we are beginning to see evidence emerging from parts of Africa as well. So I've definitely gotten emails from researchers in the continent asking me about the potential ways to start tackling this disease. I've gotten emails from Ghana, in Ethiopia, Gambia, Nigeria, and also I was very fortunate to be in Kenya this summer, where we are now beginning to do some work related to this disease. What's really unique about this is that it is really emerging in hot and warming tropical farming communities, which tells you two risk factors. Being a farmer means you're probably doing a lot of work outside. If you're in the tropics, if it's only emerging in the tropics, heat exposure is likely playing a role. And if you're a farmer, you're likely using many different kinds of agrochemicals. So this type of risk factors are quite different from the typical kidney disease risk factors you see. Here, people get this particular disease at the age of 35 even. They even die at that young age. It's not associated with the typical risk factors like diabetes or high blood pressure. And often men are impacted from this disease. So our entire research program on this topic is built around trying to understand what are the environmental exposures that are associated with this kidney disease, and how do we study it in a way that we can capture this disease early on so that we can start coming up with preventative measures. And the three main risks that we found and others have found that explains this disease is exposure to heat, as I mentioned already, and exposure to environmental contaminants, and also social determinants of health, especially poor socioeconomic status. And one other key factor that we've identified in our group is also that potentially this disease might be starting early on in life. We are already beginning to see that general declines in kidney function and increase in kidney injury in children living in these communities. So our hypothesis is that children, and perhaps even during fetal development or kidney development, while they're still inside in the womb of their mother, are exposed to some types of environmental exposures that are prevalent in these communities that we keep measuring, that increases their susceptibility to later life kidney diseases and adult exposures that they see that eventually leads to kidney failure. So not only we have to be able to identify these risk factors, you also have to be able to look at how these risk factors affect these individuals from pretty much since conception all the way till they unfortunately get the disease. So this is a complex problem to tackle, and a problem that's directly associated with the environment that these individuals live in. And it's obviously, as you can imagine, climate change is intensifying every one of these risk factors. And the number of days farmers have to work in potentially increases because now they are experiencing increased drought season, so they have to work longer and harder to generate the same number of crops that they used to grow. They may have to use more chemicals now because the crop yield is low. And also means that there's more chemicals now being added into the drinking water supplies, and the chemical concentrations of the drinking water supplies are increasing, and not to mention how heat stress is becoming a bigger threat in these communities. And this list kind of goes on in terms of how climate change is intensifying the potential risk factors that are associated with this disease, especially kidney, especially the risk of heat stress on kidney failure. And because of that, what has come out in the last few years is that this Time magazine article, which says chronic kidney disease is poised to become the black lung of climate change. In the New England Journal of Medicine, which is, as many of you know, is a premier journal in medicine, described this disease as a quintessential and sentinel climate disease that's emerging in the world. Right? So this disease allows us to think about how does risk factors like climate change are affecting our own health. And not only it helps us to obviously understand this disease, but also helps us to give a framework around how do we study these types of complex problems in a way that not only we can characterize the risk, but also we can mitigate prevalence. So in our own work, we think about this work from the perspectives of climate scientists in how do we characterize heat exposure levels, for example. We think about it from the perspective of analytical chemists who can measure the types of chemicals in the environment and also chemicals that are inside the individuals that are exposed to those chemicals. We need the help of epidemiologists to be able to do population health analysis. We do a lot of lab work in our own lab, combining efforts from these other research groups. And we also obviously have to work closely with data scientists to merge these different types of data sets coming together, and eventually also end up working a lot with social scientists to think about some of the social determinants of this health. So that's risk characterization. But when we think about mitigation and reducing prevalence, we have to work with clinicians and the health sector. The educators in the community play an incredibly important role in making sure that this message gets through to children and also that to their families afterwards. We also have to work with national and local policy agencies, regulatory stakeholders. We think a lot about working closely with community leaders, which we've been very fortunate to do. And I'm incredibly thankful for those community leaders who are helpful to us in this work. Obviously, industry partners play a big role, especially in the industries involved in the provision of chemical supplies to these communities. And also because this is an emerging global problem and not just in Sri Lanka or in one country in South America, we also have to think about this from a global perspective. So as you can imagine, there's a clear need for transdisciplinary approaches to understand this disease and to prevent this disease. And unfortunately, we are not seeing that. We are seeing interdisciplinary research, but we are not seeing transdisciplinary research in this example, and also in many of my encounters around the world doing work in this space, but also understanding and thinking about, trying to understand and think about climate change and health outcomes. We are not seeing the level of transdisciplinary research that's needed. When I say interdisciplinary research, in our group, we work with climate scientists. We work with my group doing epidemiology work and lab work. We work with analytical chemists. We work with clinicians and the health sector and the educators. So that's one silo of researchers that we bring together. In another silo, we work with educators and community leaders. That's another horizontal pillar that we work on. And there are some vertical pillars where we think about integrating data scientists into analyzing our data set. So when I think about this, what I see is a really great interdisciplinary team that integrates knowledge and methods from different disciplines to tackle a common problem. But is this a transdisciplinary approach, which is built on this idea of transcending the boundaries we've built from our traditional academic silos, for example, or for historical reasons, that don't go beyond our individual disciplines. And that's where we really need to put our effort towards moving forward in tackling climate change-related health outcomes. And this was really beautifully outlined in the introduction speech given by the director earlier. So what do I mean by a transdisciplinary approach to climate and health? And to me, and especially from the lens of studying this kidney disease, it's the intentional formation of academic research groups from different disciplines and fields, and including non-academic partners into that conversation to combine practical knowledge. What do the community leaders know? What do indigenous communities know? With academic insights to tackle the problem. And the really important part here is that the group is formed before we start publishing papers and before we start writing articles about our own research interests. And I don't want to suggest that there is no value in the interdisciplinary approaches that we've taken, but if we really want to make breakthroughs to better understand climate and health risks and better mitigate climate and health risks, we really have to be thinking about forming these intentional research groups to try and understand how do we tackle these diseases. What I see is that, especially here at Duke University, but also in several other places around the world that I've been fortunate to interact with, we're beginning to see that instead of traditional departments, institutions are trying to form think tanks and centers for climate and health. And that is this intentional formation of intellectuals in one place, whether your intellectual capacity comes from getting a PhD or an MD, or being an indigenous community leader in your own community, or you're a farmer who really intimately understands the links between the environment and your health. Bringing those groups together, and that's something I'm beginning to see through centers that are forming. For example, at Duke University, we have the Duke Climate and Health Alliance that's beginning to do this type of work. And then it's really important to think about this beyond the ivory tower that we call it, right? To think about creating a better space for non-academic partners to be engaged in research, not just at the end to hear what you found, but to be able to help with problem formulation, interpretation, and then also be involved in dissemination, because they can play a major role in taking the knowledge that's created in the center to the communities that are most impacted by some of these diseases or risks that are already emerging. And I think the most important thing that I see that's happening and that we could all be doing is to start training the next generation differently. I think we've trained ourselves and the generations before us to dive really deep into one discipline, which is incredibly important. There's incredible value in that type of training. But in parallel, we can also start generating PhD students and other researchers and our undergraduate students and master's students, and also, importantly, our medical doctors, to think a little bit outside of their discipline and integrate research areas and knowledge areas from other disciplines, especially from social sciences, to start tackling in order for us to be able to tackle these diseases. And this is a theme that I'm seeing. And when we think about this from a really broad framework, one such framework that's really stood out to me is the planetary health approach, or planetary health as a framework. Hopefully many of you heard of it. If it's not, I would really encourage you to go and dig into some of the literature around this topic, but I'll give a really brief overview of this. But the goal of the planetary health framework is to address this type of complex global scale problems and bring in public health, human health, ecological health, as well as non-academic partners, both from industry, government, and also communities, to look across multiple domains and dimensions to minimize health risks that can emerge. So in the context of climate and health, according to WHO, we think about injury and mortality from extreme events, heat-related illnesses, non-communicable and communicable diseases, non-communicable diseases like the kidney disease we are studying, vector-borne diseases, mental health disorders. All of these are resulting from or are associated with climate change. And also, these are associated with secondary effects of climate change like malnutrition, migration, lack of access to healthcare. To understand these types of disease outcomes, we really need to be thinking about these different sectors that I've outlined in this image, taken from an organization that's really worked on this space, And the important part is to think about this from multiple lenses initially, from a cultural and behavioral lens, from a technology lens, who has the wealth, who's philanthropic in your community, and from a governance lens. And then think about the proximate causes like air quality, water quality. Think about ecological drivers, which also include climate change, but also pollution, biodiversity loss. And then also think about underlying drivers of those ecological drivers, like our yearn for consumerism, the demographic shifts we are seeing because we want to go live in a different place, our yearning for technology. So thinking about these from these different sectors and then combining that knowledge to understand health risks is what the planetary health framework provides us. And this is one place to start, but I think this is a great place to start developing your own ideas that pertains to your own community. And it's really important to also think about the scale at which you want to address these problems in. What region would you like to focus this on? Or do you not care about the region, but care about the disease and health outcomes? For example, you could say, I want to do this work only in Nairobi. Or you could say, I want to look across cardiovascular diseases around the world in the tropics or around the continent. Or the other way to think about the scale is to think about climate-specific scale. So you could think about, I just want to understand how heat stress is driving health outcomes, and then follow that paradigm or framework that's described in the planetary health architecture. And where to start? And this, perhaps this type of approach can often be a little bit overwhelming, but I think the first place to start, like any scientist would do, is to go and read the literature, review what are the ongoing efforts, try and understand where are courses being taught in the relevant topics, and start a conversation, facilitate a conversation with multiple stakeholders in the form of workshops. And this is really where institutional support comes in. Institutions can play a huge role in facilitating these types of multidisciplinary conversations in your own space to try and better describe the problem and try and get multiple brains in the same room from many different sectors. And that could then hopefully lead to a steering committee or a leadership group that can really start identifying the domains that are most important to tackle the problem at hand. And this is obviously an iterative problem. This may happen for several years before you can actually launch the framework that's most suitable to tackling the problem that you're interested in. This type of framework is exactly what we are trying to do now at our university to try and think about this kidney disease problem that we are seeing around the world. So hopefully, once you have this type of framework in hand, the next step obviously is to try and apply for funding, try and engage other partners and collaborators in a way that can help you move these research projects along. And when I think about what type of opportunities that we have for enhancing research and collaboration, especially research and collaboration in this transdisciplinary framework context, I just want to quickly mention that especially when you're seeking funding from organizations or agencies like the WHO, United Nations, or the US National Institutes of Health, where you could be strong in getting these types of funding is to develop institutional strength and capacity, show commitment to long-term training, especially training the next generation, and creating a track record of policy and advocacy efforts. And from everything I've seen so far in my little time that I've spent in Kenya and talking to colleagues from East Africa, is that these attributes already exist. They're already there, they're strong, they're impressive. And I don't see that this will ever be a limitation in trying to partner with international collaborators. You also then need local and regional and continental collaborative networks, and we are already seeing that through Arin. So that's already there. But where I think there could be some advancement made is to think about robust data systems. At the end of the day, all of this work will generate tons of data. Climate data are massive, climate data sets are massive. So really being able to create climate and health data sets and databases through institutional support or through governmental support will go a really long way in attracting researchers into looking at these climate and health problems in your own region. And especially developing these interoperable data platforms. So someone in another part of the world can actually look at that data, work with you to try and understand the potential risks in your communities. That can go a long way. And this is something also our university is actively working on, is to create these types of data platforms for Africa, for Asia, and for South America. And finally, I want to say that I think, and this is my personal opinion, that Africa can actually be a leader, in fact, the leader in climate and health research. And I'm not just saying that. And I think this type of statement comes from the fact that what I've seen around the world, what I've seen the types of researchers that are emerging, and based on the individuals that I've been really fortunate to meet over the last year during my time there. And I think this is because there are multiple leverage points for the continent that can be used to be the leader in this climate and health research space in the world. One of them is that there are sentinel populations in the continent, populations that are already seeing incredible vulnerabilities to climate change. Studying these populations can teach a lot about what are the risks and what are the markers of risks that we could be identifying in other parts of the world. And this includes indigenous communities, particularly because indigenous communities understand and have an ingrained knowledge set on how the environment played a role in their health for centuries. And learning that information can go a long way. So I think the continent is full of these types of sentinel examples that we could be studying. In parallel to that, what I also have seen is the incredible genetic diversity and physiological adaptations to multiple environments in and across the continent. A good example of this is what we see in Turkana. This is an example from a group that I'm familiar with, where they published a paper showing that individuals who are living in extremely hot and high heat, dehydrating conditions have evolved or have accumulated a certain mutation that enable their kidneys to function for a longer period of time without water. And understanding these type of genetically sensitive regions in your populations can go a long way in informing identification of risk, not only for your communities, but also for the rest of the world. And this goes along with the diverse ecosystems and climate zones that are incredibly valuable natural laboratories that are set up. And the scale at which you see in Africa is much larger for these types of diverse climatic zones and ecosystems. And there are individuals and organisms living in harmony within these environments that are really sensitive to changes in the environment. And studying these can go a long way in identifying the global response to how climate change is going to pose a health risk to us and also to individuals and animals around us. And I think the two other factors that I want to quickly mention is that there's an incredible growing workforce that are really well educated, that are equipped to handle global problems, and incredibly connected, globally connected youth that's emerging in the continent. And they carry a lot of power. If you're in the audience, you have a lot of power in making a difference in this space because of the way that the world has set itself up over the last 20, 30 years. There's a lot that the emerging workforce can do. And along with that comes many technological innovations and advances that this workforce can think about, especially in the renewable energy space, and also in the space of mobile health, providing digital health to remote areas, which allow you to not only provide health access to health, but also generate really critical data in trying to identify which communities may be experiencing challenges due to increasing climate change effects. So with that, I'll wrap up and I'll say thank you so much for having me here. It's an incredible honor, and please do stay in touch. My email is right here, and I look forward to hearing from you one day. And thank you again. So I'll stop my presentation there.
Thank you very much, Professor Nishad, for that presentation. And indeed, we have learned quite a lot from that. When it comes to diseases like kidney diseases, they can be triggered by a number of environmental stressors. And we have also learned that also this can be hereditary, because when you are also analyzing maybe young ones who are born they were found with these diseases. So it is something we can be able to control once we identify those stressors and are able to work on them. That was quite enriching presentation. In addition to that, you have clearly brought out the issue of working together, the collaboration. You could not be able to do this research alone, but you brought on board the social scientists, clinicians, the policy and the policy makers, the regulators, the community leaders, the academia, so that even as you try to address the issue of kidney diseases, you could get even some learning, some insights from these other disciplines. And this is what enabled you to come up with a conclusion about the environmental stressors that affect people and are likely to lead to these kidney diseases. That was quite insightful. And you have also brought out the issue of what can organizations, what can individuals do in terms of ensuring that there is this collaboration amongst maybe institutions, amongst individuals that are doing research when it comes to climate change and health. And you have highlighted the issue of ensuring that institutions are strengthened and also their capacity build. In addition to that, the need for continuous training so that we enhance and build skills and knowledge of even the researchers. The need also for ensuring that you work with what we call the existing networks that exist. And you also mentioned the issue of data. And that is something that we are already working on, even with the putting in place the capture platform that will ensure that data is available. And it was quite insightful. And you have told us that Africa as a continent, we have the ability to address or to solve our problems. You have told us that by giving us quite a number of ideas, the issue that we have a diverse ecosystem, the issue of the adaptation, both genetic and physiological, and also the element of the sentinel population based on how we are exposed to the climate change, how we are vulnerable. So we are able to do some research and learn so that from that we can be able to even get some sustainable solutions and try to reduce the climate change impacts on health. I think the audience may be having questions for you, but that will come later, even as we progress on. It is now my pleasure now to bring on board the next session. Maybe before that, maybe let me hear from Evert, has raised up his hand.
Good afternoon, good evening. I think it would be a disservice not to say thank you to Professor Nishad for a very well researched presentation that you have shared with us. It is, to me, that is the beginning point for all that we are going to talk about and even think of doing. Thank you for that, and above all, thank you for connecting the would-be scientific study to be understood even to the non-academic, and all of us to understand that the non-academic groups, who I think are the majority in our communities, have a place in all this research that we are trying to put together. And above all, potential. Thank you so much. I'm Reverend Evert Mugarura, my public health specialist and a researcher. And I was very, very much impressed by your presentation.
Thank you so
Yeah.
much. Thank you for that comment, and also a really wonderful summary of what we just talked about. And happy to stay connected. I'll be in and out for the rest of the day, but please do send any questions you have, and really look forward to future interactions as well. Thank you again for having me.
Yeah, thank you once more, Prof. And thank you, Evans, for raising that. Indeed, it has been a good presentation. Even the non-academic community are able to understand even what really is triggering this issue of the kidney diseases. Yeah, so the next session is the case study presentations. And we have a number of presenters that we are going to listen to them, what they have been studying on, and it is time now for them to showcase, just to tell us really what they have been working on. And I want to believe that they have been communicated to, that they'll take a short period of time in presenting just key highlights of their study. And we are going to begin our presentations with Ndirangu Ngunjiri from the University of Nairobi. Ngunjiri, are you around? Ngunjiri, are you with us? Or we could move to the next one as maybe you continue to prepare your slides. The next one is Dr. Pamela Nekesa from Daystar University. Dr. Pamela.
Just a minute, and then just a minute, few minutes, please.
It's okay, thank you. Dr. Pamela is the director, Hamu Media Enterprises Limited, and she has quite vast experience when it comes to research, administration, and also policy. And when you look at that, she just brings in the issue of collaboration. She's able to interact with the policymakers, the academia, and also the administration. And in addition to that, she has also led some initiatives within the communities. In addition to that, mentoring and also counseling. Dr. Pamela is going to talk about the status of climate change and health research and impact in Africa. Welcome, Dr. Dr. Are you there?
Yeah, I'm there. I'm actually getting my laptop. I don't know what is happening. I don't know if I can present using the phone, and then if you can hear me well, and then I will send the slides. Is that okay? Or maybe the other person goes first, as I get the Zoom here on the laptop. Is that okay? Hello?
Yeah, I think what you can do, maybe you can share with us your slides so that we shall be able to project for you, but maybe is Ndirangu ready?
Yeah, I can share the slide.
I'm available.
You can share your slides with Anne. Ndirangu, are you ready?
Yeah, I'm ready.
So I share on the email address or?
Yes, on the email address.
Okay.
Yeah, Ndirangu, welcome. Ndirangu is also another presenter from the University of Nairobi. Ndirango is going to share with us the topic climate change and health, navigating the interconnected challenges for a resilient future. He is a PhD student, and I think this is part of the work that he's doing to enable him to graduate. Welcome, Mr. Ndirango.
Thank you so much for that introduction. I believe you can see my slide. Confirm, please.
Mama. You can see.
Are you able to see my slide, please?
Yes,
Confirm.
yes, Ndirango, you can see the slides. Proceed.
Okay, thank you so much. Good evening, good morning, good afternoon, depending from where you are getting us from. As introduced, Ndirango Njiri from the University of Nairobi, a PhD student. And today I'm going to share with you about climate change and health, more so navigating the interconnectivity and the challenges and the resilience of the future in this area of climate change and health. And most of my presentation will come from this picture, and this will be we summarize all my presentation. Sorry, something is passing around. Sorry for that. Climate change, we find that when we talk about health risk in climate change, we have several risks that are related to climate change. One is extreme weather events. You have heat waves, sea level rises, air pollution, vector distribution, and water scarcity and reduction of food production. If you can see right now, some part last year we had a lot of heat in Nairobi. Lake Nakuru has already water has evaporated the lake. Then right now, if you walk around the city in Nairobi, you find the air is very polluted. Then out of these climate-related hazards, we find that there's vulnerability factors that make these people to vulnerability, that bring due to climate, that bring the risk. You have the demographic that's depending where you are located, people in the slum area, people living in the suburb areas, geographical, biological factors, and health status. Some people have health issues, socio-political, socio-economical, the poor and the rich, health system, and gender inequality. And then we have the exposure. On the other side, we have the exposure of the people and the communities, health workforce, the infrastructure you have, the energy system, water system, and the food and health system at the same time. Then out of this, we find we have health outcomes. One of the health outcomes we have is the injury and the mortality goes up due to weather events. We have health-related illnesses that come on board. We have respiratory illness that come out of this health as a health outcome, waterborne diseases, and among vector-borne diseases, malnutrition due to lack of food, and also we have mental and psychological health, which is currently affecting Nairobi, in the country in Nairobi, and the country in Nairobi most we have mental issues going up. And then finally, we have the health system facilities. It also impact on the health facilities we have, and the effect of their health facilities. When you go to most of the health facilities, they are operated, we don't have equipment, you don't know good infrastructure. All these climate change brings health risk that making the health facilities be more operated. That's in summary. Now I can go to my background. Most of the growing amounts bring most of carbon dioxide and human activity, which are more behind the climate change. Sea level rising, as I was talking, like Nakuru, like Bogoria, and also you have like Baringo. And the weather patterns are shifting, ice caps are melting, and the temperature continue climbing day and day. Then you have intercontact between climate change and health is increasing the most critical issues as an environmental shift. Every day, temperatures are rising. Today is very hot, tomorrow is very cold, and these climate change issues. Why this study? One endeavor is not only to admit the presence of climate change, but also analyze the consequences of climate change, relation to public health, thoroughly, and also present a comprehensive picture by understanding the complex links between conditions, such as increased temperature, severe weathers and occurrences, and finally contribute more to the profound knowledge of necessity. The objective of the study, the first objective, to examine the climate change influences to public health, identify how the extreme events and shift make the shift in disease patterns. Also to identify the population most vulnerable to health impact of climate change, and provide evidence-based recommendation which can be used in making policies, and finally assess the readiness of the resilience of the health system in the country. in summary, in the methodology, we conducted a comprehensive review from the existing literature. This is a form of secondary data collections. We did epidemiological data from health organization, WHO, KNH, Ministry of Health, among others, AMREF, among others. And we had a climate indicators, e.g. temperature rises, air quality levels, and extreme event of the weather. Then we did the survey and interviews, providing equality insight among the experience and the perception of health providers and the community. Also, we did the Department of Weather Forecast, and also we reviewed existing health policies and the frameworks that are existing, and also emergency response and mechanism that support development of the combination of resilient of health systems in the country. The impact of climate change in our finding, we find that we have a lot of injuries and fatalities and mental health impacts. Asthma, we have a lot of increase in asthma and cardiovascular diseases. And we find from our presentation, if you see in the inner circle, we have the climate change. You can see there's sun, there's rain, there's cloud, there's lightning. And this we find it brings the temperature increase, temperature rises, more extreme weather. Also, we have rising in sea levels and increase in carbon dioxide levels. And this brings severe weather, air pollution, change in vector ecology, increase allergens, water quality impact, water and food supply impact, and environmental degradation, and finally extreme weather. Out of this impact, we find we have health-related illnesses, post-migration. For example, if you see in Lake Victoria, we had post-migration, and also Lake Naivasha, malnutrition is happening, and cholera disease. If we go in there right now, we keep on doing cholera vaccination. Respiratory diseases and asthma are analyzed. Malaria and other Rift Valley fever and other West Nile virus are analyzed. These are from our findings. And also increase in exposure and weather and extreme weather events such as heat waves, wind floods, and droughts. These bring climate-sensitive diseases, as stated in our picture, which are health-related diseases and vector-borne diseases such as malaria, as indicated earlier. Climate change disproportionately it affects vulnerable population, more so the low-income families and rural areas. Climate change also climate-related health crises intensify the pressure already strained health system. As we say, when you go to Kenyatta and other health facility, we find they're already strained by the system is already strained, and also addressing the climate health challenges requires coordinated action across all the sectors, from the national government, urban planning, from the county government, the Ministry of Water and Sanitation, and other infrastructure and policies to reduce the air pollution and other issues. In our conclusion, severe weather increase has a risk of damage and forced displacement and water infections, especially among the vulnerable groups. Global climate change which increases the heat-related illnesses and deaths. Policies to make healthcare and surveillance and infrastructure and climate to develop and be implemented by governments, and globally, community must prioritize research on international cooperation when they're addressing climate change and health issues. In our recommendation, strengthening the health facility, we recommend strengthening the health facilities, encourage government and international organizations to integrate climate change policies with the health policies. Right now, you find climate policies they are based at the Ministry of Environment, but they're not based in the Ministry of Health. Implement community-level adaptation programs that can educate population on health risks that are related to climate change, and health care services of climate-related population. And finally, promote sustainable practice within the health sector, including energy sufficient and healthcare facilities, reducing medical waste, as well as having sustainable supply chain. Thank you so much for having me.
Thank you, Ndirangu, for that. You have clearly brought out some recommendations that you think are likely to help make the health system to be resilient just for the future. The issue of strengthening health facilities, community level adaptation programs, the issue of also promoting sustainable practices within the healthcare sector. I think those are good recommendations. And just note that maybe after this, we will encourage you that now to finalize on your paper and share with us, because one of the outputs of this conference is these case study presentations will later on be published with Taylor and Francis. Thank you for that. Yeah, the next presenter, the next presenter is Dr. Pamela. Are you ready? We have received your slides.
Yes, I'm ready.
Thank you. Yeah, so we are sharing that. You can now proceed.
Yeah, maybe. The theme of the conference is Bridging Knowledge Gaps, Promoting Transdisciplinary for Climate and Health Resilience. But we can go to my topic, please. Good afternoon, everyone. I forgot to say hi. I'm Pamela Murunga, presenting from Bungoma County. I'm giving a brief on the status of climate change and health research and impact in Africa. We can go to the first slide, the objective of the study. The overall objective of the status of climate change, health research and impact in Africa is that the overall objective of climate change and health research in Africa are to reduce the negative health impacts of climate change by building resilient health systems and strengthening national capacities. And we do this by considering these factors. One is identify health risks. Identify health risks specific to each African country, as they will vary from one country to the other. Build resilient health system, strengthen the capacity of health system to respond to climate change. Interventions, integrate public health and environmental interventions to manage health risks. So the health sector should integrate with the environment sector so that they can be able to work hand in hand to be able to manage the risks that come with climate change. Raise awareness, increase awareness of climate change and air pollution, especially in areas affected by them. Develop early warning systems. The system should be developed in advance to be able to cap such challenges. Create early warning system for heat, floods, and drought. For example, the government should prepare in advance for cases of floods, not to respond to the effect when it has already occurred. The next slide, we go to the specific objective of the study, please. You can move the slide. The specific objectives of the study is build better, more climate resilient, environmentally sustainable health system as central and primary healthcare components. The second specific objective is protect health from the wide range of impacts of climate change through implementing climate-informed surveillance and response system. Next slide, please. The problem statement of our study is climate change has a significant impact on health in Africa, including issues such as disease outbreaks, vector-borne diseases, mental health, and social and reproductive health, access to healthcare, and affordability to basic amenities. Climate change is an increasing threat to Africa. Increasing temperature, changes in rainfall patterns has impact on people's health. And in addition to this, climate leads to forced migration. And in the long run, basic amenities are strained, thus impacting individual health negatively. Due to climate changes, you'll discover that people will tend to move from one place to the other. The central argument of the paper is the status of climate change and health research and impact in Africa is that climate change has a negative impact on human health in Africa. And this is especially true for vulnerable population. The paper discusses how climate change can cause increase or can increase the spread of diseases. Climate change can increase the occurrence and intensity of disease outbreaks and can increase the spread of diseases in some areas. For example, malaria is related to tropical climates, and climate change is expected to change the prevalence of malaria in some areas. Next, please. Climate change can cause food security problems. Due to climate change, we can experience food insecurity. Climate change can worsen existing food insecurity in countries that are already struggling, and we can see it especially here in Kenya, in Africa. Due to changes in climate change, we have experienced food insecurity. Climate change can lead to limit access to clean water and sanitation. Floods can cause our water to be polluted, and therefore it has adverse effects to human health. Climate change can damage water infrastructure, which can lead to water scarcity and increased competition for water. This can contaminate drinking water and increase the spread of diseases such as cholera, dysentery, and even typhoid. Next, please. The central argument of the paper continues: climate change can cause heat-related illness. Exposure to extreme temperatures can result in heat exhaustion, heat stroke, heat syncope, and heat cramps. Climate change can cause disrupted health system. Natural disasters caused by climate change can disrupt health services and impair health infrastructure. Next, please. The theoretical underpinning of our study is that climate change has a significant impact on human health in Africa, and the theoretical framework for understanding this impact. Such facts have to be considered, and these factors include environmental exposures. Climate change can lead to both direct and indirect exposures, which include changes in air, flash floods, food, and water quality. Another underpinning theory is the social determinants of health. Climate change can impact health-related behaviors and socioeconomic factors. Another theory is infectious disease. Climate change can increase the spread of infectious diseases such as malaria, cholera, dysentery, and even dengue. Next, please. The continuation of theoretic underpinnings of the study: food insecurity. Wildfires, floods, and drought contribute to food insecurity. Health-related illness. Climate change can increase the risk of heat-related illness and mortality. Chronic conditions. Prolonged heat stress can lead to chronic conditions such as chronic kidney disease and neurodegenerative diseases. It can also have the healthcare costs. Due to climate change, there is increase in healthcare costs, which cannot be afforded well, especially by people living in the third world, Africa not being an exception. Socioeconomic disruptions. Climate change can lead to social and economic disruptions, which can compound its effect on human health. Next, please. The last part of the theoretic underpinnings is the sea level rise. The sea level has risen around Africa over the past 30 years, threatening coastal areas with flooding and erosion, as we have even seen in the recent years. Drought, arid, and semi-arid regions are likely to suffer longer and more frequent drought cycles. Next slide, please. Methodology. The first methodology adopted is the qualitative research method. During this paper development, qualitative research method was adopted to develop this paper. An analysis of climate data. An analysis of climate data was done in order to give predictions, the future climate conditions, to provide statement and analyze the relationship between climate change and health status. An assessment of climate change can be carried out, for example, analyzing rainfall patterns in various parts, temporal climate changes, spatial interpolation of climate factors, and health risks. Yeah, next, please. The second methodology is informative interviews, brief interviews on agriculture, environmental, and health experts on social and environmental determinants of health, such as clean air, safe drinking water, sufficient food, and secure shelter. Then next, predictive modeling. Use historical weather data, monthly disease diagnosis records to create a model that predicts the relationship between climate in disease. Next, please. Data collection, gather region-specific projections of health outcomes, health-related exposure, and different adaptation scenarios. Dissemination of information, share the knowledge gained from the data with the local communities so that they can take preventive measures. And then lastly, surveillance, use early warning system for heat, drought, and floods. Next. Let's go to the summary. The summary of the key findings. That climate change has significant impact on Climate change has a significant impact on health in Africa, including extreme weather. Climate change causes more frequent and severe extreme weather events such as heat waves, flood, droughts, cyclones. These events can cause injury, illness, and death, can also damage infrastructure that provides clean water, food, and healthcare. Next, please. Infectious disease. Climate change increases the spread of infectious diseases through vectors. Malnutrition. Climate change reduces food security, which can lead to undernutrition and malnutrition. Mental health. Flood victims are more likely to experience mental health problems such as depression, anxiety, and obsessive compulsion.
Sorry, Pamela, trying to meet the person. Pamela, kindly proceed. Apologies.
Yes. I was on summary of the key findings. Say that malnutrition, climate change reduces food security, which can lead to undernutrition and malnutrition. Mental health, flood victims more likely to experience mental health problems such as depression, anxiety, and obsessive compulsion. Next, please. Heat stress. Exposure to extreme heat can cause heat exhaustion, heat stroke, and other heat-related illness. Heat waves can also increase mortality, especially among people in chronic health conditions. Economic growth. Climate change is projected to reduce economic growth in low and middle income countries, including Africa and Kenya being part of it. Conclusion. Climate change is disproportionately affecting Africa's health and well-being, and the impacts are expected to increase. Such as disease, climate change is increasing the spread of diseases like malaria, dengue fever, and yellow fever. Warm temperatures, more rainfall create more suitable habitats for biting insects that spread the diseases. Water, climate change is affecting water availability and quality, increasing the risk of waterborne diseases. Next, please. Food. Climate change is affecting food availability, quality, and diversity, which can lead to food insecurity. Natural disasters. Climate change is increasing the frequency and severity of natural disasters like cyclones, severe storms, and drought. The health system. Natural disasters can disrupt essential health services and impair. Then we come to the last part, references. Thank you. Come to the end of my presentation. Thank you.
Thank you, Dr. Pamela. That has been a great presentation, just bringing out the real issues affecting communities in Africa, the issue of the healthcare cost, the issue of the socio-economic disruptions, food insecurity, among others. And these are issues that we can be able to collaborate so that we try to address them even as Africans, where it is us who are highly vulnerable to the effects of climate change. Yeah, so thank you for that. We shall come to the questions and answer session later. Our next presenter is Antoinette Wangari. Wangari, are you with us?
Yes, I am. Good afternoon.
Thank you. Antoinette is a presenter, and to say maybe it is amazing that she is a final year in Jomo Kenyatta University, and already she has begun engaging in research, geospatial analysis, and remote sensing. This is a technique that she's going to use, she has used in trying to map the aspect of asthma incidence in Nairobi County. So welcome, Antoinette. share with us your findings?
Thank you. Just a minute. Can you see my screen?
Yes, we can see it.
Okay. Good afternoon. My name is Antoinette Wangare. I'm a GIS analyst with StatsPeak Group, and I'm also a final year student at the Jomo Kenyatta University of Agriculture and Technology. I'll be taking us through this research topic, the impact of climate change on air quality and respiratory health, a spatial analysis of asthma incidents in Nairobi. Yeah. So climate change has a profound implication on air quality, which in turn affects public health. So according to WHO data from 2019, respiratory diseases are the leading cause of death in Kenya. As you can see here, tuberculosis causes 61.7% of deaths per 100,000 population. Yeah. Also lower respiratory infections with 46.5%. So the objective of the study is to analyze air pollutant trends based on climate variables. The variables that are used are rainfall and temperature, and also to determine a relationship between poor air quality, climate changes, and respiratory diseases. So this is my study area. I'm aware we are a diverse group from all over Africa. So this is Kenya. And just inside Kenya, we have Nairobi here at the center. And then this is my study area. So Nairobi is the capital city of Kenya, and we have a population of about 4 million people. And since Nairobi is rapidly urbanizing and experiences industrial growth, and due to its large population, it also has increased vehicle emissions, we suffer from these pollutants, aerosols, particulate matter, which is particulate matter, and nitrogen dioxide, carbon monoxide, and sulfur dioxide, and ozone, which are all a result of incomplete combustion of fuels from vehicles. Yeah. So the data that I used for this study is Sentinel-5P for the air pollutants with a resolution of 3.5 by 7 kilometer. Also have the climate variables, which is rainfall from a database called CHAPS, and land surface temperature was calculated from Landsat 9 imagery with 30-meter resolution. Have health data from the Kenya Health Information System and our partnership with MOH, Ministry of Health, and population data from the Humanitarian Data Exchange and Meta. So this is my methodology. The data was collected, Sentinel-5P from Google Earth Engine, cleaning and preprocessing of the data from Kenya Health Information System. The rainfall and temperature were then related with the air quality maps and the respiratory cases. Then I conducted a hotspot analysis to identify populations at risk of air pollution exposure. Then a trend analysis to see the relationship between rainfall, temperature, air quality, and respiratory diseases, and also a heat map of respiratory cases to see where there's a cluster of asthma cases reported in our health facilities. This is the data that I have on respiratory diseases. So as you can see, Nairobi generally has a high disease burden on respiratory cases, which is quite concerning. This data is from 2023 January to 2024 around September. We have a consistent number of high cases, with most months having over 100,000 cases. We also have period fluctuations, which shows a correlation between environmental factors such as weather and pollution levels, leading to a spike in respiratory diseases. From this first chart, you can see it's a rainfall line graph together with the respiratory diseases. And from this other one, it's the land surface temperature and respiratory diseases. So just to show the correlation, we have the months with the highest rainfall, it's February and June, between February and June 2023. That's the first quarter of the year, and October and December 2023, the last quarter, and March and June 2024, which is also part of the first quarter. The highest temperature levels are also recorded in the first quarter. That's between January and February 2023, and July and October, and January and March 2024, also the first quarter. And the peak of the respiratory diseases are recorded between March and May 2023 and January and March 2024, which shows that in periods where there is high rainfall and high temperature, we also have high respiratory cases. So so the question I asked myself was why is the data presenting like this? When it's rainy, pollutants should be less, because the rain will dissolve most of the pollutants and have them washed away into maybe the soil and the water, leading to other pollution cases, but not air pollution. And also in cases where there's high temperature, the air will rise from the ground level and disperse into the atmosphere, which will not have an impact on respiratory diseases, since there's a lot of dispersion of this kind of cases. But the combination of high rainfall and high temperature leads to high humidity, which causes a concentration of gases near the ground level, which leads to a spike in respiratory diseases. In this, this is what has caused the spike in respiratory diseases. Moving on. These are the level of pollutants in 2024. So for formaldehyde, also as a result of incomplete combustion, we have a spike in March, May, and July 2024. Also forming the first quarter, aerosols, January and May 2024, nitrogen dioxide between February, May, July 2024, and carbon monoxide between February and March 2024. There's a study by WHO that says that urbanization is also one of the causes of respiratory diseases. So the air pollutants peaks coincide with high rainfall, temperature, and respiratory diseases, indicating that humidity could be leading to the trapping of these pollutants closer to ground level, therefore increasing human exposure. Okay. So I went ahead and mapped areas that have a high risk according to the different air pollutants. So this is aerosols, which is also known as particulate matter. And we can see these counties are highly exposed to the areas. From the map, the 10 represents areas with good air quality, and 50 represents areas with poor air quality. And from the second map, you can see the green areas are relatively safe areas. They have little exposure to aerosols. The red areas are areas which have a high amount of exposure to aerosols. So the counties the sub-counties that have a high exposure to these aerosols are Ruaraka, Mathare, Embakasi West, Embakasi Central, the list goes on. But if you're from Kenya, especially Nairobi, you will know that these areas are actually industrial areas where we have most of our factories. The map for formaldehyde, you can see it. So for this one, we have most of the values ranging between 20 to 40. And the areas that are affected are Embakasi West, Makadara, Kamukunji, Starehe, Kibra, Kilimani, and Dagoretti. For carbon monoxide, we have a high level of pollution in Roysambu, Ruaraka, Mathare, Embakasi West, Kamukunji, and Starehe. And as you can see, most of these sub-counties are actually repeating, meaning if there's pollution for one kind of air pollutant, such as formaldehyde, most likely there's also carbon monoxide in the mix. Yeah. This one is for sulfur dioxide and nitrogen dioxide pollutants, and you also see Embakasi West, Makadara, Kamkunji, Starehe, Kibra, Kilimani, Westlands, Mathare. And for sulfur dioxide, we have one county with a lot of pollutants, which is Ruaraka. Yeah. These counties are near the CBD and also along major highways. These sub-counties, I mean, are along major highways, which are one of the major causes of also this pollution. So according to the air pollutant maps, Langata and Kasarani are areas with the least amount of air pollutants. So I created a heat map just to show areas with a lot of reported cases. And as you can see, Langata has a few reported cases, and also Kasarani. But you can see clusters of cases with a deeper red, meaning the more number of cases there. Yeah, a larger number of cases than other areas. Yeah. You can also see the number of cases reported per wards. You can see Westlands has a high number of cases reported, Roysambu. We also have Langata here, but I'm tending to think that this is because Langata also has a lot of credible hospitals, and that is why people are actually reporting to these hospitals. Yeah, Embakasi East also has such a high number with 250,000 cases almost reported. Yeah. Okay. I also went ahead to assess populations at risk of this air pollution from different pollutants. So the population at risk for sulfur dioxide pollution is 1 million, almost 2 million of the population in Nairobi is exposed to high levels of sulfur dioxide. And you can see further the number of women, the number of men, the children, the youth, people 15 to 24, women within reproductive age, and the medical doctors know the impacts of air pollutants to expectant women, yeah, and people 60 and older. Yeah, so if this was, let's say, a viral infection like COVID, this kind of analysis would be able to tell the team which area needs to be vaccinated. Yeah, from just looking at the people at high risk. We also have
Wangari.
Yes?
Sorry for interrupting you. Kindly try to wrap up, kindly.
Oh yeah, okay. Yeah, so this is the same for the aerosols, formaldehyde, carbon monoxide, nitrogen dioxide. So the discussion and the conclusion, the analysis suggests that there's a relationship between high rainfall and high temperatures, which are creating conditions that increase the level of air pollutants. This in turn is contributing to the high peaks of respiratory diseases. Humidity reduces the dispersion of the air pollutants, concentrating them and creating chemical reactions that form additional pollutants, which have an adverse effect on respiratory diseases. So the reason Kasarani and Langata experience relatively better air quality is due to the low industrial activity, because these areas are mostly residential, and Langata is also close to a green space, which is the Nairobi National Park. So my recommendation finally is just to develop models that show the interaction of climatic variables such as rainfall and temperature with the air pollutants, also to study the infiltration of outdoor pollutants into indoor environments and assess their impact on the health of the occupants, and investigate the role of vegetation in regulating air quality in areas with elevated pollutant levels. Yes, thank you.
Thank you very much, Wangari. That was quite insightful, using technology to get data, and you have clearly showed us that the relationship between pollution and respiratory diseases. And this study really can inform even the county government, even and other stakeholders where to even install the heat sensors just to monitor and be able to maybe inform for policy making. We have 2 case studies, then we can go to the panel discussion. I will suggest that the remaining case studies will take the shortest time possible. You can just highlight your key findings, then maybe a recommendation that is where you emphasize on, and then we can go to the panel discussion that is the next session. Yeah, so the next presenter is Anne Omolo, who is going to present on investigating flood-induced groundwater contamination and cholera risk in Tharaka Nithi County. Welcome, Anne.
Thank you so much. I hope I'm audible.
Yes, you are audible.
Okay, sharing my screen.
Yeah, you can share.
Okay, I will be presenting a study on the correlation between climate change-driven flooding and cholera outbreaks in Tharaka Nithi County. So this study will assess how extreme rainfall events that are linked to climate change contributes to flooding patterns that increase cholera risk, particularly in areas with limited sanitation. So the objectives of this study, I had 3 objectives. The first one was to explore the role of climate-induced factors such as flooding in triggering cholera outbreaks. Second was to examine the conditions and effectiveness of the sanitation facilities within this county, and then to identify the high-risk areas and factors that contribute to cholera. So these were the data that was used, the climatic data, that is the rainfall data from charts, and then the flood maps, and also the wash data, which showed the location of sanitation facilities and their conditions, and the disease data, which showed cholera outbreak records and the historical waterborne diseases data, and also the demographic data, which showed the population distribution. So this was the methodology, which would involve data collection and pre-processing, and then mapping of the cholera risk factors. The risk factors are the flow direction and elevation of the area of study, the proximity of these boreholes to contaminants, population distribution, cases of waterborne diseases in the study area, and then the flood areas within the study area. With these ones, I did a multi-criteria decision analysis so as to obtain the flood risk map, the cholera risk map, sorry. This is our study area, and it's Tharaka Nithi County, which is it's located in central part of Kenya. So first of all, I wanted to view the annual precipitation patterns in Tharaka Nithi County, and here we can see there's variability in precipitation over the years, with years such as 2018 to 2020 receiving very high amounts of rainfall, and those years like in 2017 and 2022, 2021 receiving lower rainfall. So this inconsistency can complicate preparedness, in which wet years increasing flood-related contamination, while in dry years will reduce the access to clean water, and this, at the end of the day, increases cholera risk. Also, I wanted to view the rainfall and disease patterns within the sub-county, within the county of Tharaka Nithi, sorry. So as you can see, the rainfall data is the line graph, and then the bar graph is the waterborne disease data in the county. So the trend suggests that there's a relationship between rainfall patterns, rainfall levels, and the spread of waterborne diseases within the sub-county. And as you can see, in 2023, there was a notable increase in both the waterborne diseases and the average precipitation within the county. So this surge in precipitation could have contributed to more stagnant water and potential flooding, which created a favorable condition for the spread of diseases like cholera and typhoid, which often is associated with contaminated water sources. So also I tried to look at the trends. So in 2023, since there was this surge, I decided to look at the monthly trends of waterborne diseases and precipitation. So we can see in March to April, there's like a surge in waterborne diseases. We can see at the onset of the rainfall event, it increases, decreases slightly, and then also increases when the rainfall, rainfall events come to like a close, and it shows like there's a stable disease case despite the low rainfall, indicating that maybe flooding is not only the only contamination source, there might be others too. But also we see here in September to December also there's like a surge, also increasing amounts of waterborne diseases in this period, which also shows like flooding might be a cause of contamination in this area. So we know that cholera is transmitted through through contaminated water and food by a bacteria called Vibrio cholerae. And in this study area, the contaminants that were being studied were the open defecation sites, animal waste, toilet overflows, and improper waste disposal sites. So floodwater can carry pathogens from these contamination sites and spread them to nearby boreholes, which can lead to the spread of this bacteria that leads to cholera. So this map shows the spread of these contamination points within the sub-county, and as you can see, in this particular region, there's a high concentration of the contaminants, and there's lesser concentration in this particular area. So also, I wanted to view the vulnerability of boreholes to contamination. So the first map shows boreholes and contaminants distribution along the downstream flow, and then the second one shows boreholes and contaminants distribution along the flood zones. So flood water can submerge boreholes, allowing contaminants like the fecal matter and sewage to seep into the groundwater, and also topography plays a key role in the spread of pollutants. So with these contaminants from these contamination points will travel along the river drainage, following the natural flow of water during flooding events. So from that, I managed to identify the boreholes and the boreholes that were at risk by doing a proximity analysis with the boreholes and the contaminants in the study area. As you can see that most of the boreholes that were a very high risk and at high risk of contamination are concentrated within this area. And in this area that is in blue, the dark blue is built up areas within the county. So this suggests that these densely populated regions are more prone to contamination, likely due to human activities. Also, I tried to look at the distribution of other waterborne diseases within the study area. We can see cholera, we can see diarrhea, and we can see typhoid. And we can see that this concentration is still within the built-up areas of the sub-county, of the county, sorry. So
try to wrap up then.
So using all these factors, I did a multi-criteria decision analysis and obtained a flood risk map, cholera risk map, sorry. So the red areas are the very high, then the orange ones low. And as you can see, the concentration of these high risk areas are the areas in which, one, they were built up areas and there were flood zones, and most of the boreholes were near the contamination points. So I also did a comparison to other counties, and as you can see, there's a clear spatial overlap between the flood-prone areas and the cholera outbreaks. So maybe for this study, for future cholera assessment, maybe we can do other analyses such as geostatistics, machine learning, hydrological and climatic modeling, or include socioeconomic data such as relative wealth index, so as to get a more comprehensive view on the vulnerable population, and also to help target interventions effectively. Thank you. That was my presentation.
Yeah, thank you very much, Anne. Also, that was quite insightful presentation, and I know your findings can really be very key, even in informing not only Tharaka Nithi County but the entire country on what are some of the maybe adaptation plans the counties can put in place to curb the issue of cholera and other waterborne diseases. And it is good you have also brought in the new technology, the GIS, the machine learning, the AI. These are now the new dynamics that we really need to integrate even in our research. We have the next presenter who is Peter Onyilo. Peter, we suggest that you take the shortest time possible. Just go to the key findings and the recommendations. Peter Onyilo will be presenting on the issue of climate change and antimicrobial resistance. This is something that has really affected most of the Africans. So it is good that you are trying to bring out how, or the relationship between climate change and AMR. Welcome, Peter. Peter, are you with us? Is he there? Okay, maybe I will suggest maybe we could go to the next presenter because of time. When Peter is ready, we can come back to you. The next presenter and the last one for the case studies is Dr. John Isunju, and Dr. John Isunju is a notable researcher. He's the one really who has spearheaded even the development of the Health National Adaptation Plan for Uganda. And today he's going to present on the impacts of climate change on health and access to health care, findings from Uganda's vulnerability and adaptation assessment that was done in 2023. Welcome, Dr. John Isunju.
Thank you very much, Chair, and I hope you can hear me clearly.
Yes,
I will try
as
much as possible to be brief. So this was a much bigger study, but we just picked out the qualitative components that was focusing on how the community is affected. And we will try to stick to the things that were affecting the community that were related to their health, especially access to healthcare settings. So the findings from this study have already informed the development of the Health National Adaptation Plan for Uganda, which was launched on 22nd August this year. So what I'm presenting, as I said, is just a component of the bigger study. So we picked out what we got from the focus group discussions, where we used the narrative inquiry methodology to pick the discussions of the community health workers, community leaders, and health unit management committee members. We did 20 focus group discussions with these, and these were about 6 of them, 6 to 10 participants. And data was collected through audio interviews, which were recorded and transcribed later. Some of what we found is that the extreme events of drought and floods really result in various health outcomes, like, for example, the spread of malaria due to increased mosquito density, but also the water stress that is constricted by drought leads to increase in hygiene-related diseases. And also the floods tend to contaminate water sources where the community depends. And from their voices, sometimes it's very difficult to delineate what you would say health effect from other effects. Sometimes some of the other effects could be economic effects, but eventually they have feedback effects on the general well-being. Others could be water stress, but eventually they turn out to affect nutrition because the communities are depending on rain-fed agriculture. So when there is water stress, then they eventually get food insecurity. And that food insecurity also translates into health outcomes. Then there was also an effect of increased interaction with the wildlife, which increased zoonotic spillovers, especially during dry conditions or drought conditions. So this increased the risk of zoonotic diseases. But also the water stress meant that women had, and especially children, had to move longer distances to fetch water, but it also predisposed the community to conflicts, what we would call local water wars, conflicts in the search for water, because they have to look for water in territories that they may not necessarily have rights to, or others may start restricting. There was also destruction of wash infrastructure, especially at healthcare settings. Like you can see, hand hygiene facilities often get destroyed either by drought, these containers crack and get destroyed, or when it floods, it may contaminate the water sources or destroy the hospital infrastructure. Storms also destroy not only the houses, but also the health facilities. And there is a lot of deforestation because people have energy insecurity. They depend on biomass fuels. There's a lot of deforestation. And as a result, the storms build over a long distance without any windbreakers. Even the health facilities are also not well protected. So eventually you end up with these scenarios, the roofs of the houses being swept away. That in itself leads to displacements. It leads to, of course, lots of other exposures. And we have seen an entire hospital being washed away, and these communities are still struggling. A lot of other issues have resulted following the sweeping away of this a very historical hospital in Kilembe Mines. I'm sure you might have heard about this one. So there was vulnerability when it comes to alternative energy options for both for health facilities and for communities. Then housing and transport infrastructure, the bridges and roads get swept away. And then I had already talked about the issues of energy, but the workforce was largely unprepared. They do not have any emergency plans. They do not have committees that are active to plan and forecast and respond accordingly. And they also don't have sufficient protective equipment in terms of floods. To do outreaches, they may not be having the resilient transport mechanisms to be able to go in hard to reach areas during these extreme events. So as a result, this cuts off communities that are living in marginal areas from receiving services. And the effect on pollution of water sources I had already highlighted. many of the alternative water sources that are existing you can't say they are robust or resilient to climate change. And when we lastly, we look at the response mechanisms that are needed to build resilience within the community context. We need to sensitize communities about resilience for water, sanitation, and hygiene, and food reservoirs, because this is what can last them in periods of drought or when they have low harvest. Then it is the stored food that eventually would come to their rescue. And then we need to promote village health support systems or village savings so that they have some resources, because part of resilience is being able to recover in time of calamity. So these village saving schemes help them to have some resources when the event strikes. And lastly, when we look at access to healthcare or actions that can be done, there's a need to strengthen local structures for effective adaptation and response. And this includes activation of disaster response committees at the health facilities. Thank you very much.
Thank you very much, Dr. John Isunju. From the presentation, you have clearly demonstrated that the development of the HNAP for Uganda actually was guided by data, and that is very crucial. And that simply means even the aspects that have been put in that plan, really, then if implemented, they will be able to address some of the recommendations you have put there for us. I think this is quite commendable. As we continue, maybe also we have presenters who are asking questions in the chat. Maybe if that is touching on the presentations that have already been done, you can also try to address them maybe within the chat as we move on. I think now the next session is the panel discussion. The next session is the panel discussion. And this is the last session of the day. And we have 3 panelists who have joined us, and we are going to engage them in a number of areas. We are going to begin with Dr. Gloria Maimela. Dr. Gloria Maimela comes from the Chance Network, of course, one of the platforms that is very crucial when it comes to climate change and health research in Africa. She is a public health specialist, and she leads climate change and health research at WITS. And apart from that, also, she has also been studying the effects of extreme heat on vulnerable populations. And based on that vast experience that Dr. Maimela has, we are going to engage her on key 2 areas. We want to find out from Dr. Gloria Maimela that within the context of Africa, of course, where you have done most of your research, what does transdisciplinary research entail when addressing health impacts of climate change? And why is this approach crucial for tackling complex challenges of the continent? Maybe you will also combine with given the existing sectoral silos in climate and health issues, what steps can be taken to strengthen transdisciplinary research and foster greater collaboration across sectors? Welcome, Dr. Gloria.
Thank you very much, Chair, and thank you for inviting me to participate in this conference. I have slides, so perhaps I can share the slides for presentation. Thank you very much.
Thank you. Could you just share?
All right. Please let me know if you can see the slides. Can you see the slides?
Sorry, yes, you can see your slides. If you could perhaps put them on presenter mode.
Thank you. Let me know if you can see them on presentation mode.
Not yet. Yes, we can see, even though we can see your presenter mode from our end, but yeah, we can see them.
Oh, okay. All right. Can I proceed?
Yes, Gloria, proceed.
Okay, thank you. Thank you very much, and thank you, delegates, for this opportunity to speak. My name is Gloria Maimela, and I'm a Senior Technical Advisor for Climate and Health at Better Child South Africa, and also a Chance Network Steering Committee member. My topic is on, well, the climate change and health transdisciplinary research in Africa, and I'm very privileged in that I've been part of the transdisciplinary research teams on climate and health. So just drawing from my experience in terms of conducting research with transdisciplinary teams. So TDR involves, integrating knowledge and methodologies from various disciplines to address problems that cannot be addressed by an individual sector. And it's essential, especially when dealing with complex, ill-defined problems concerning human, and we know climate health is one of those complex challenges that concern the human and the environment and the climate. TDR allows for joint research and significant exchanges among scientists, decision makers, and knowledge users. It's actually one of the things that we use in participatory action research, involving all the other stakeholders, including government officials, etc. It's also an opportunity to create for comprehensive solutions that consider multifaceted climate-related health issues. And for example, we are in a process of designing and implementing adaptation interventions, and we're using that transdisciplinary team to be able to come up with some of the adaptation interventions to deal with the impact of climate change on health. So it draws from multiple fields. It draws from public health specialists. I work with a team of climate scientists. We have an environmental scientist as well. We work with people from meteorology. For example, I'm from South Africa, so we work with the South African Weather Service. It requires policy, policy science, and also engineering and architectural science. Again, when designing some of the interventions, it's always great to have these scientists, contribute to the studies. Why is it crucial in climate and health? Because we know the multiple effects of climate change on human health. We also know it accounts for the complex interconnectedness between ecological, social, and economic systems. So you need to be able to navigate towards that. So the whole climate change requires that interconnectedness between all these systems. Also the interconnectedness of sustainable adaptation solutions, and the multiplicity of adaptation measures that need to be taken to address the impact of climate change on health. There are, obviously, to get to the solutions, you need a diversity of actors to get involved, and also the solutions need to target various population groups and different types of communities, and hence why you need that team on board. TDR entails collaboration, obviously, between across the various disciplines. It requires stakeholder engagement, and this is very critical to get buy-in, particularly from the beneficiaries, from the communities, and also from policymakers. It requires a systems thinking to appreciate that interconnectedness. It has to be problem-oriented, focused, and then it needs to ultimately lead to policy development. So there are different phases, of TDR, and that's where some of the challenges lie within the phases, starting from the conceptualization, the implementation, translation, and development. And then some of the challenges lie in the different assumptions, and we certainly pick that up. And epistemological positions, tensions with conceptualizing approaches, because we come from differing sciences and the way we approach science is different for different teams. It can unfortunately result in longer project duration as we try to grapple with the differences between the sciences and also problems communicating with and beyond the team. Bram et al. Talked about integration. When it says integration is an inherent and the most challenging characteristic of TDR. It's also a core quality criterion to reach validity in transdisciplinary research along with consensus. So that consensus on problem framing and research objectives can be quite challenging. So I've just thrown in just examples of areas in climate change and health that require TDR. And the previous speaker talked about vector-borne diseases in climate change, and that requires ecologists, epidemiologists, and climate scientists. Food security and nutrition requires agricultural science, nutrition and climate scientists. The urban heat phenomena, urban heat islands and public health are some of the projects that we're doing with the World Bank that require urban planning, meteorology, data science, and health sciences. The climate and mental health, which has become a major issue, requires science from psychology, sociology, and climate science, as well as air quality and respiratory health, which requires environmental science, public health, and engineering. There's this classic, example of, One Health approach that requires collaboration between the veterinary science and public health to understand the interactions between the environment, animal, and human health. So this is a classic example where you need a whole transdisciplinary approach towards addressing One Health. I've just thrown in an example of a study that I'm working on as a local PI in South Africa, that we work with various scientists, various partners, and across the disciplines. So the climate scientists, social scientists, public health experts, data scientists that are in there to come up with adaptation and mitigation to reduce the impact of heat on pregnant women and infants and healthcare workers. So just that complexity of working with that team, developing early warning systems, for example, coming up with health indicators, coming up with adaptation and mitigation interventions. Is an example. Another project that is run by a colleague of mine from Vets PHR, Matthew Chesik, is the Heat Center, which on its own is transdisciplinary in nature. And then we work, they're looking at developing innovative solutions to again, mitigate the health impacts of heat on climate change in Africa, and they're using data scientists. They're working very closely with data scientists, epidemiologists, biostatisticians, to come up to integrate climate data with maternal and health data to also try and come up with indicators and early warning systems. So in terms of the last one, steps to strengthen climate health, we need to break down the silos and promote cross-sectoral initiatives. We cannot just think that climate change is about health. We absolutely need to work together. We need to build capacity and maybe specific training on TDR approaches, because this is a field where we just we kind of like assume that we'll get together and everything will be fine. But perhaps there needs to be a specific training on how to approach transdisciplinary research, and then funding. But we are seeing a lot of that funding, the funding opportunities that are coming now for research are specifically saying we want a transdisciplinary research team. And unless if you provide that, unfortunately, you become unsuccessful. That is one of the ways to promote TDR. Policy integration to bridge the departmental gaps. And then we talked about transdisciplinary policies. Policies that say, once we've developed the evidence from research, we need those policy integration policies so that everyone is able to work towards the same goal. And I spoke about community engagement as key, as part of participatory action research. I just want to throw in the Quebec report from Pierre Gosling et al. That says the report shows that most public health adaptations do not require a great deal of innovation, but rather involvement of different stakeholders and a strengthening of infrastructure and management methods of health and governmental authorities. And the true innovation involves the need for more inter-university, interdepartmental, and transdisciplinary work. And lastly, this is a study that was conducted by my colleagues, Prof. Wright, in South Africa, and they talk about something that is even more interesting. This is transborder transdisciplinary approach, when it's not just about within borders. Climate change knows no border, but being able to extend or expand the transdisciplinary research across the borders. And their conclusion is that our ability to mitigate the synergistic health impact of climate change relies on the development of creative and comprehensive approaches that transcend many of the epistemic, geographic, economic, and political barriers that exist. So, and that's that from me, Chair. I'll take questions later on. Thank you very much.
Thank you very much, Dr. Gloria. That was a nice presentation, just illustrating that indeed transdisciplinary research is happening in Africa, and you have been able to demonstrate that. So the issue is that now we need to upscale this so that at least all parts of Africa are able to adopt and embrace transdisciplinary research because of the benefits that it has. I think now we go to the next presenter, panelist. And then after that, we can now wrap up with questions for all the presenters. The next presenter is Nancy Marangu. Nancy Marangu is the Executive Director of Chemichemi Foundation, Kenya. She is also a policy expert for the United Nations Framework Convention on Climate Change. And most interesting is that Nancy has worked and like supporting the youth, women, and indigenous communities. And based on that, actually, her discussion today will really bring out some of the key findings or key learnings that she has been able to establish even through the interaction with those different groups within the community. Nancy Marangu is going to look at some of the strategies that can enhance locally led research and data collection to ensure meaningful co-creation with the vulnerable communities. And based on that, I think she'll be able to provide some examples where the same has been successfully implemented. Welcome, Nancy.
Thank you very much for the introduction. My name is Nancy, as you've all heard. And without further ado, I would just like to delve into the strategy that enhance locally led research and data collection to ensure meaningful co-creation with vulnerable communities. And today I want to look at the specific needs of indigenous communities and persons with disabilities. And from my experience of working with communities, the first thing I believe that we ought to do and do it more meaningful to have more impact is to have community-based participatory research. In September, we were carrying out a renewable energy project. And before we began the actual training, we had to carry out a participatory research for the community. We had to localize it. The research was conducted in Kimeru for the people to understand what they were being asked and for them to be able to understand what exactly that we were looking out for. The second thing that I believe that needs to be done is capacity building and training. Most of the times when we go out to the fields, we go with our experts. But I feel that especially when including and integrating vulnerable groups, we need to train them on data collection skills. Why? Because we are empowering them with technical skills and opening their worldviews to another world of career opportunities. Because technical and scientific careers are not a preserve of the people or a few, but it is for everyone. So these skills have to be localized. We have to bring them as our research assistants. We have to train them. We have to give them the skill. We have to give them the power to be able to go with us to the field for them to do the work. Thirdly, how do we use accessible digital tools when we are collecting data? Are we mindful? Sometimes we are going to a local village where we have our grandparents. Are we able to bring them on board to train them on how to use these skills so that they can own the process? Because climate and health nexus is for everyone. It's not for those in the urban that eliminates those in the rural areas. How can we ensure that they're able to use the mobile applications? How are they able to use emerging technologies like GIS to collect the data for themselves and by themselves? The other important point that as a policy person and as a community servant, I believe needs to be done and done better is community-led climate health indicators. At the rural levels, there is the deficiency of current data. And even though the data exists, the county government could have data. Are we able to access it as non-governmental organizations? As non-governmental organizations, when we collect, we share it with the county government for them to cascade it to the national government. And lastly, is the integration of indigenous knowledge into the nexus of health and climate. We have to appreciate that something already exists. Our grandparents, those in our villages, have something that we can also learn from. And it's more of coexisting. It's more of harmonization for us to be able to say, these are the indigenous systems on health and climate, and these are the emerging trends on health and climate nexus. And to conclude, what can we do to empower the people to be able to provide data-driven solutions for them, by them, for their solutions? The first point is we have to resolve the environmental health, the environment and health conflict between communities. Do we know what is happening in other counties, for example? For example, if we are in Laikipia region, are we able to know what stakeholders in Rumuruti County are doing vis-a-vis what the stakeholder in Nanyuki County, in Nanyuki are doing? Because all of them are in the same region. Secondly, we have to strengthen community capabilities and provide livelihoods, technical training, empowering the people, giving the power to them so that we are able to leave them with a skill after we've gone with the data, as most often as we will do. What are they left with? And lastly, we have to be intentional to enable communities to make more sustainable choices that are cost effective, to integrate local adaptation strategies for health and climate that are replicable and that are scalable. And finally, and most importantly, accessibility. Persons with disabilities must be carried to the conversation because they have an ability that we always forget to focus on. We have to tap into their ability. We have to say it in their language. Make the data as accessible for them to be able to tell us what they know that we also need to know. Thank you.
Thank you very much, Anne. Indeed, you have clearly demonstrated that you work with those particular groups, even based on the insights you have been able to give. The issue of capacity building, accessibility, and also the integration of indigenous knowledge, among others. And I think that now brings us to the end of the panel discussion. But I want to believe that we have heard maybe from the people who have attended the conference, they have some questions maybe they want to ask so that they just understand well how can we be able to collaborate, or what areas can we be able to improve to ensure that the issue of transdisciplinary research works well. I'd like to invite questions. Maybe we can have at least a question for each of the panelists. And then maybe if I have a question, maybe for each of the case study presenters, we are just going to take some 10 minutes for question and answer session because of time. Any question for the panelists or case study presenters? I know some of the questions have already been addressed in the chat section, but I can see Evert Mukwezi has a question. Kindly, Evert, proceed.
Oh, yes. Thank you very much, moderator. And my quick question goes to Dr. Gloria. First of all, thank you, Gloria. You presented very, very well. I enjoyed and followed very well your presentation. My quick question to you is on as you implement this model and approach to transdisciplinary approach to research and interventions with regard to climate change and health, there are challenges that you have encountered that we need to take note of so that we don't repeat the same mistakes that could be out there, or something we can learn from the challenges as a way forward. Thank you so much.
Through you, Chair, may I proceed to respond?
May you proceed?
Yeah, thank you. Thank you so much for that question. And, this goes to lessons learned. I think, first of all, be careful. Obviously, depending on your topic, you would need to know exactly who your collaborators should be for that transdisciplinary. So you need to be very clear that, do you need a climate scientist? Do you need a meteorologist? Because then you might find that some, researchers or some fields become redundant. So you need to be very clear on who it is. You need to be very clear in terms of, and I mentioned that the conceptualization, because as I said, we have different ways of conceptualizing the problem, depending on our background. So you need to get on board and conceptualize. Also, the other thing that I found very challenging when working with transdisciplinary teams is that understanding the science from the others, and how that links to your science. That's also key. So maybe spend time getting them to understand, for example, data science. How does data science work? What are the frameworks that are being used for data science, etc. And that's just an example. So just understand, having the basics, so that capacity building within the teams themselves on the different sciences, so that then you can be able to apply them to your science. And then lastly is the pitfalls, because it can take a lot of time, as I mentioned, alluded in my slides, that to and fro and not getting onto the same, getting the same picture can actually delay your project. So just be aware of that and make sure you manage time effectively. Thank you. I hope that answers your question.
Yes, but there is this problem of people coming with their own agenda. Yeah. And they want to just drive the agenda and not necessarily wanting to listen to the whole approach that you are trying to do so that you can come up with evidence-based kind of research and data that is not biased. Have you encountered such? And how have you gone about it?
I think it boils down to your outcomes. You need to go back to your outcomes. What are we trying to answer here? Yes, it's great that you want to know 1, 2, 3. You want to get your own. You have your own agenda. You need to, develop some kind of methodology. But what is the outcome? What are we all looking? What are we? And especially in funded research, what are we funded to develop? And also, how is that outcome going to influence policy? So getting the policymakers into that mix as well will kind of like help you to shape that, to manage the different agendas. So funding sources, outcomes, other key stakeholders, including beneficiaries, could also help to make sure that we narrow and we're all on the same page as far as the outcomes of the research are.
Very much for that question, and I believe that it has been addressed. There is another question here that is directed to Nancy and also Dr. Gloria. The question is, what are the synergies and trade-offs between health-focused policies and economic growth policies? And then the second question is, so that we can combine, how can health, climate, and economic sectors collaborate to create integrated policies that address the combined challenges of climate change, public health, and economic growth? Those are the questions that have been addressed to the two panelists. So either of you can be able to respond to that. Can I begin with the, yes, proceed?
Thank you very much for the question. It's a very good question. And this comes back to public-private partnerships. Everyone has a share of the pie on the table. Everyone has to be willing to give up something for the sake of the community, because at the end of the day, the climate health conflicts create opportunities at the community level. If the public sector can come up with the infrastructure, the communities can come up with the personnel. And that way, through the creation of synergy, there is the economic gain for the people. At the end of the day, it's about who will be willing to share what. Because yes, health is for everyone, climate affects everyone, and it is the people who are at the center of it. So regardless of which sector you are at, in my opinion, everyone has to give what is within their power, within their reach, so that everyone can gain, and over and above, the biodiversity can be preserved. Thank you.
Yeah. Perhaps for me to respond, it's simple. For the economy to grow, you need a healthy population. and so, and then this, I'm looking at the second question, how can we collaborate? One of the ways that we collaborate is, where you see this happening is in the workforce and climate change. So therefore, so bringing that back to the workforce, that you need a healthy workforce to be able to contribute to the economy so the economy can grow. So that's where the policies, the health and the economic policies need to merge to be able to address the impact of climate change on the workforce, especially outdoor workers, and then how that then builds or supports economic growth. So I think for me, that's a great example of where these policies can be merged for better outcomes. Thank you very much.
Yeah, thank you. Thank you for that. I think it addresses the questions. And indeed, the person who asked the question has agreed that the responses, he has agreed with them. Yeah, any other question? Any other question for the panelists or case study presenters? Do you have any other question? I can't see any question. Maybe my question, I have a question, and I want to direct my question to Wanjiro, who was looking at the aspect of pollution. And I think I saw that question somewhere, that the question was, when you are looking at the levels of pollution, did you compare maybe day and night? And or do you think maybe day and night has an impact on the pollution? And then also that having another impact also on the respiratory diseases? Then another question would be, do you think the element of land use and land cover has also an impact on the spread of these respiratory diseases? No? Yeah, those are the two questions. Antoinette?
I was having some network issues. Can we come again?
Okay, the first question was, you looked at the issue of pollution. Did you look at this data maybe and compare day and night? Or does day and night have an effect on the levels of pollution? Then number two, do you think the issue of land use, land cover has an impact also on the spread of these respiratory diseases?
For my study, I think I focused more on a monthly interval period. I didn't focus on the day and night, mostly because most of my images are satellite imagery, and they pass a particular time at a particular time period. So maybe the aspect of day and night would be something I would have to look into. For the land use and land cover, because in Nairobi is an urban area and tends to experience higher temperatures than surrounding areas which aren't as urban than urban areas. So that is also something I would include in my research. Yeah. Thank you for the question.
Yeah, I think that calls for now further research, and I've just seen you have finished your undergraduate. Maybe you can consider that as you pursue your master's maybe program. The last question is goes to Anne, who was looking at the issue of flooding and cholera outbreak. I don't know, why did you select Tarakaniti? Oh, I'm told she's not there. I think she's not there. We shall just make a follow-up, because all these questions we are asking, we shall ensure that we incorporate them even in the final report that we shall be able to share with all the participants of this conference. And I think that then brings us to the end of question and answer session. I think I want to just thank each.
Perhaps just to point out, I think there's a question that on the chat by Henry. I'm not sure who this is directed to, but he's asking the importance, how important will drones be important in these research programs? Perhaps Henry, do you want to expound on which programs are you talking about? The transdisciplinary research, or which programs are you specifically asking about?
Good afternoon.
Good afternoon.
What I'm I mean, we are talking about research, okay, and which involves, let's say, some monitoring and evaluation, etc. And also, we are researching, for instance, he just talked about activities happen in the night, in the day. How can they be known, or how can they be calculated? And the drone has so many features that it can also help in giving additional information of what is happening. So are we considering using drones? They are very important. I mean, where humans can go, they can go and collect information and bring them.
Yeah, thank you very much, Henry. And I think I agree with you, even with as technology advances, drones are going to be very important. They are already important, in fact, because we are able to use them to get the remote data that we can't really get even as just like that. So it is good that we integrate even the emerging technologies, the AI, the machine learning. You have brought the issue of drones in the collection of this localized data that is really needed to address climate change impacts on health. Thank you very much. I think to that point, I want to really thank each and every participant who has participated in this afternoon session that began at 2 p.m. And we have really learned quite a lot. We have learned that already in Africa, there is a renewed focus of transdisciplinary research, as was mentioned by the Executive Director, Dr. Atela, and also Dr. Gloria has also just given key examples that there is indeed transdisciplinary research. And then we have also learned there is also need for strengthening the existing community of practice. This will enable even collaboration and engagement. This will ensure that then the data or the findings that are coming from research are able to reach even at the policy level. We have also been able to understand or that we can integrate the modern technologies and innovations, that is GIS and remote sensing, machine learning. And these are technologies that we need to embrace even as we try to get data for the platforms that we have established. And then we have also been able to learn today from the discussions that there is need for strengthening of institutions and also building their capacities. This will ensure there is opportunities for collaborative research. Then there is also need for robust data systems, establishing robust data systems or databases. This should be a one-stop shop. And of course, Nancy brought out the issue of accessibility. Why are we collecting this data? Of course, we are collecting the data to inform. So there is need for collaboration and also ensuring that this data is available to be used by the intended stakeholders. Then also Dr. Gloria brought out, Nancy brought out the issue of the need for public-private partnerships. These are very crucial because they create more opportunities for transdisciplinary research. And then also another key learning that also we have learned today is the issue of ensuring that there is continuous stakeholder engagement. This ensures buy-in, and especially when we bring together even the policymakers, they are able even to learn and integrate part of these findings even as they develop the necessary policies that are needed. And indeed, this has been quite a good learning session. What do we advise our presenters for today? That perhaps you could be able to share your presentations so that at the end of the conference, we shall be able to share with all the participants that have attended this particular conference. And then just to mention the issue of AI and machine learning, and also just to touch on the two undergraduates that have been able to present their work here, that as Arin, we have a project on leveraging mathematical AI for climate change resilience. And God willing, next year around March, we are going to call for fellows so that fellows can be able to apply. They are trained, mentored, and then at the end of it, those that will really do well, they'll be given some mini grants to continue advancing research when it comes to the issue of AI and machine learning. Perhaps we can integrate the issue of climate change and health in that particular research. I think that now brings us to the end of the today's session. Maybe I want to take back the session to my colleague to finalize and wrap up.
Yeah, thank you very much, Dr. Gembi, for taking us through the session very well. Mostly to you, participants, and the presenters, our panelists, and those that shared the research in the presentations. We'd really like to appreciate you taking time to share your experiences, your knowledge with us, and we don't take it for granted as we have opened up the discussions. And just want to point out that tomorrow we continue this discussion. We shall be having side events as well, beginning at 11 a.m. That is East Africa time. We shall have a morning session that will be highlighting locally led adaptations metrics for Africa. And then after that, at 12:30, we shall be having a side event hosted by the Ministry of Environment, Directorate of Climate Change and Forestry. They will be looking at areas of promoting research excellence and dialogue on meteorological information and how this impacts the practices in Kenya. And at the main session at 2 p.m., similar to this, we shall now opening up the transdisciplinarity aspects in terms of enhancing what are the opportunities, and thus looking how we can co-create and collaborate, further. So we shall have speakers that will be trying to dissect this topic, looking at the pathways and areas of translating the platforms that can be used and the networks and the likes that can be used to enhance transdisciplinarity. So we urge you to join us tomorrow so that we can continue the session. I know it's really exciting to see this coming through and so many learning so many things. We shall be having book presentation as well, so ensure that you do not miss that as well. And I just remember that there's been questions about how to join the network. Anne Irongo's been sharing communicating with you via email. I shared a link to join a channel on climate change and health that she's leading. So if you're really interested in following the conversations, kindly follow that link that Anna shared. If you could just reshare it again, just for everyone to see. Anne, thank you very much. And just to go back to the book presentations before I forget that I have seen the questions and I've seen some that have been asked have been responded to on the chat. So that is really helpful. And we really encourage you to share with us the final findings from your research so that we can incorporate in our learning, even in the Capture platform that will be taking on the climate change and health conversations. And I think it is okay to leave the conversation there and look forward to tomorrow, where we shall now be taking on the conversation further to continue what we have learned today. And we look forward to seeing you tomorrow. So yeah, before I'm seeing Betty Khan saying something about LinkedIn. Is there a question about that?
Yeah, I think I will check. I'll respond to you on LinkedIn. Thank you.
Thank you, Betty Khan. Yeah, sure. So all right, so that's it from us. We thank you and we look forward to seeing you tomorrow. Goodbye.
Goodbye and thank you.
Bye-bye.
Thank you very much.
Thank you. Goodbye. Thank you so much. Thank you.
Goodbye.
and
Thank
God
you so
bless you.
much.
Thank you.